Going to be having Alberta coming in studio to help us better understand this conversation around sexual and gender-based violence and the fact that it has gone up. It has spiked by quite the percentage during this time that we have been in quarantine and in this lock-in situation. So more of that is coming up in not too long. And of course, a quick look at the newspapers this morning, with most of them talking about the number of patients who actually escaped the Kenya Medical Training Facility, quarantine facilities yesterday under what has been termed as unknown circumstances. We will be letting you know the background to that story in not too long. Welcome once again.
Well, the fourth annual or the fourth edition of the Kalasha International TV and Film Market was to take place this month, but because of COVID-19, it did not. It was supposed to be taking place at the KICC. But the question is, do you think that coronavirus can limit creativity? Well, no, because creativity still continues even after or during the COVID-19. Well, this morning, we'll be talking with the CEO of the Kenya Film Commission, that is Timothy Owase, in regards to film and how we are showcasing film activities of companies from Kenya and the rest of the world. Stick around for that discussion coming up in a bit. Good morning to you. My name is Ram Aguko.
This morning on our last segment, coronavirus update, we continue looking at how this pandemic has affected different sectors, and this morning our focus will be on the education sector, where we try and see how this e-learning program is faring on in different countries. We look at how the countries in Europe are doing with this e-learning. We come down to Africa and look at some of the challenges that the African continent, and also specifically Kenya, is facing in ensuring that every student has access to this platform. Remember, in Africa and even here in Kenya, not every learner or every student has access to online platforms, has access to the credits, has access to TV and radio. So how is this affecting them in this period where everyone has moved online? We look at the numbers, we break it down for you, and look at some of the challenges faced by most of these countries, especially here in Africa. My name is Doreen Arange. Good morning.
Good morning, I'm Regina Manyara Guitar. You're tuned to KBC Channel 1, and top on news is that 4 people perished yesterday after floods swept them away. This is a heavy downpour has been witnessed in various parts of the country, and the total number has increased of cases, confirmed cases of COVID-19 here in Kenya, with 15 more testing positive as per government's speech, or rather announcement yesterday. The total coming to 297. 15 more at a time when government insists that you need to consider every other person infected or a potential person to be infected, so that you need to stay home and adhere to the laid down precautionary measures. Good morning once again. We want to remind you that we are live and we appreciate your feedback. So on our social media handles, you can get in touch with us directly to the station at KBC Channel 1 TV on Twitter. And on our personal, or rather individual Twitter handles is at Jane Wamboi, at Ram Aguko, at Ray Manyara, and at Doreen Arange. And you can find this also on Facebook Live and YouTube too. If you do not have, the courtesy to sit in front of a television set, we are bringing out that information right to you on your cell phone or on your tablet. Remember, we are live on those social media platforms there. You can also let us know where it is that you're watching the broadcast, and we're sure going to sample your feedback in the course of this broadcast. Good morning, I'm Regina Manyara Guitar. Now let us look at those stories that have been making headlines in the last 24 hours, and is that at least 4 people have perished courtesy of flash floods that have been witnessed in some parts of the country on Monday. Now in Karissa, 4 children perished when their homes were swept away by floods, and that gave rise to landslides in Kipkelion. The region experienced more than 6 hours of downpour amid a warning that heavy rains will continue to hit most parts of the country.
Heavy rains being experienced in most parts of the country continue to wreak havoc, leaving in their wake a trail of destruction. In Kericho, 4 children died on Monday after landslides resulting from rain swept their homes in Kipkelion West constituency. Among the fatalities are 2 siblings aged 12 and 15 years. Areas that were greatly affected by the rains which pounded over 6 hours include Kamasian and Kunyak, where a 14-year-old boy was swept trying to cross a river.
Kajaribu kuokoa na majirani mpaka kitu saa moja alikuwa amepoteza maisha yake.
Tumepoteza watoto 4. Tumepoteza mtoto huyu wa miaka 6 hapa, na tumepoteza watoto 2 kule Nyasakia Lelu, ambao poromoko la ardhi lilizika nyumba yao na wakapoteza maisha yao.
Area lawmaker called on the government to swiftly move into the area to address an ensuing humanitarian crisis.
Mvua imevunja mabarabara na mto imefurika kupita kiasi. Tunaambia serikali ya national government ipatie county commissioner wa Kericho helicopter moja ya kumonitor situation katika Kericho county hii.
In Naivasha, tens of families have been displaced as property worth millions came under destruction. This coming after River Karati burst its banks, leading to flooding in areas around Delamere.
Imejaa na kuna watu ambao kadhaa wameathirika, na kuathirika kwao ni maji ambayo mto Karati imefurika na imeingia katika kwa manyumba ya watu kadhaa ambao nyumba zao zimeingia maji, zimetapakaa maji.
Kuuliza wenzangu wakasema hiyo maji iliingia mwendo wa saa 7 usiku, na hata watu wale wa supermarket walijaribu kuwapigia simu wakuja wajaribu kuokoa vitu zao, lakini hawakuweza. Hapo ndani ya supermarket imeingia kwa store, na nafikiria kuna vile vitu imeharibika huko ndani.
Sasa wakati nimekuja hapa nimeshizwa sana na vinye hii mto ya Karate vinye imefuja bank na imeharibu vitu mingi sana, kama kwa supermarket, kwa store yao vitu ya mamilioni ya pesa mingi. Hapa nyuma yangu kuna hii butchery, kuna mafridge, kuna vitu mingi sana sasa zimeharibika.
The riverbank could not contain the swelling waters resulting from the heavy rains that have been pounding the area.
Tunaomba serikali iingilie kati, ni kwa sababu maji imekuja imetukuta mpaka kwa manyumba zetu. Ukiingia kwa manyumba zetu maji imezama huko, hata tunashindwa sasa tufanye nini.
Katika ile highway bridge tunaweza tengeneza, ama serikali itengeneze tu, ijenge molding ambayo utakao kuwa ukizuia maji kupanda upande ya juu kuelekea upande wa manyumba za watu, ifuate mkondo wa maji vile inavyotakikana. Hata kama ni mto imefurika, hata kama ni mvua kubwa imenyesha, na hiyo maji haitawahi kufikia watu hapa tena.
Meanwhile, residents of Kimelok area along Enkare Narok River in Narok North constituency have been urged to take precautionary measures and halt agricultural activities with possible flash floods focused within the region. Authorities warn that the situation may worsen in the coming days, given that the region will continue receiving heavy rains. Finally, residents of Karissa have been urged to take precautionary measures and move to higher grounds. Karissa County Commissioner Meru Mwangi said water levels in River Tana continue to rise, adding that it could burst its banks anytime now to avoid impending calamities.
To be more specific, the areas along Karissa town and the Boda area towards Masarani and Sabubu area. Those are some of the areas that are normally affected by the flood. We want to ensure we sensitize some of the public so that they evacuate before the floods come.
Now, the cycle of anguish and distress has revisited the people of Ahero as flood waters continue to wreak havoc in an area that has for years suffered from the phenomenon. Hundreds of families have been forced to spend their nights in the cold after the River Nyando burst its bank yesterday morning before flooding Kobura, Ombenyi and Apondo villages as well as Ahero Market. Our reporter based in Kisumu, Achala Simon, has more details on that.
A heavy cloud literally hangs over Kisumu County as Mother Nature fired a warning shot of what awaits the county and many other parts of the country in the coming days following heavy rains, with the weatherman predicting sustained rains in the coming days. Residents of Umbei, Kobura and Apondo villages in Kisumu County bore the greatest burden as raging floods from Nyando River swept across the villages on Tuesday morning.
Actually, hii maji imekuwa ikikuja na imekuwa ikiflood. Lakini ya this time around naweza sema imekuwa in excess. Kwa sababu imekuwa ikikuja huko mwanzoni, imekuwa ikikuja na sana huku maji haikujangi sana huko. Inakujanga na inabaki, kuna pesi ikifika inakwamia hapo ikienda huku chini. Lakini sasa hii this time round hata ukitazama huku imekuja in excess.
Phenomenon we experienced it as much as this in 1961. But since the irrigation was instituted here, it went down a bit. But now it has come up, so we do not know where the problem is.
And it is not just the villages. A hero market that borders the river was literally a no-go zone, with the entire market submerged. Traders at the market risking it all to salvage whatever little they could.
And even right now, as we are speaking right now, there are pupils down there who just can't reach here. And in fact, if there could be a boat, they could have rescued the situation by requesting the county government at least to bring us anything to make us rescue those young kids down there plus their mothers. And starting evening, since the rain started, there are some of them who have not even eaten.
Nearby rice fields were also submerged, with locals counting losses. Most of the residents have now relocated to the busy Kisumu-Nairobi highway, with the latest phenomenon likely to see an increase in the waterborne disease, as well as casting serious doubts on adherence to the government directives in the fight against coronavirus.
You talk of social distancing. Hatu kitazama hapa, jamani, 1.5 meters apart. Itawezekana hapa, na hapa tunapata usaidizi. Unasema corona ina spread fast kwa tukikaa karibu. Sasa tuseme hata hapa ukitazama jamani, hii ni distance kwa.
They now want tributaries feeding into River Nyando and Nyando itself desilted as a short-term effort to avert floods, as well as construction of Soin Dam, which could act as a long-term deterrent.
The river sides, there used to be a lot of desilting, draining of this river, the tributaries of River Nyando, and that really helped a lot. But in the last 2 years, we have not seen any desiltation or draining taking place.
Achola Simon, reporting for Channel 1 News from Kisumu County.
A way for an opportunity to have these diseases, typhoid, cholera, and the likes. I hope that we can also practice water harvesting for drier periods of the year. Now, 15 more people tested positive for COVID-19, bringing the total number of infections in the country to 296. Now, Health Chief Administrative Secretary Dr. Mercy Mwangangi says Mombasa County continues to register high numbers, accounting for 7 of the positive cases recorded over the last 24 hours. The latest statistics coming amid questions over how the low number of samples tested at a time when mass testing should have gained impetus.
The number of confirmed coronavirus cases in the country is rising towards the 300 mark after 15 more positive cases were confirmed on Tuesday, bringing the total to 296. The numbers portraying a new trend where Mombasa County is slowly consolidating its status as one of the COVID-19 hotspots after registering 7 new cases over the last 24 hours.
The 15 positive cases, 7 are from Mombasa, 6 from Nairobi, and 2 from Mandera County. I am glad to inform you that 5 patients have recovered and discharged. We now have a total of 74 recoveries. We are seeing an increase in cases in Mombasa. Yesterday we recorded 7 cases. Today again we've highlighted a new increase in number of cases. And this is exactly pointing out to the fact that we have established local transmission of this virus. And therefore communities do need to take charge.
Community transmission being a major concern, with only 6 of the 15 cases being from the various quarantine facilities.
And 9 were picked up by our surveillance teams. And this is a clear indication that the infection is increasingly growing within our communities. And it is therefore very critical that we observe very strictly the measures that we've put in place with regard to containment.
However, the Ministry of Health says that the decline in numbers tested in the last 2 days was attributed to challenges with some of the sample kits across the various laboratories.
We are facing a challenge with regards to some of the sample kits, the nasopharyngeal swabs and oropharyngeal swabs that are utilized for taking of samples. And therefore, that is why you're seeing our numbers in terms of samples tested reducing. We have, however, engaged our supply chains to be able to avail these samples so that we can ramp up our testing capacity.
The ministry is now calling on Kenyans to play their part in flattening the curve by adhering to the ministry guidelines such as regular hand washing, donning of masks, social distancing and obeying the curfew regulations. Nancy Okware, Channel 1 News.
Now, at the same time, is that you needed to get on our KBC various radio frequencies, because this morning we have an interview with President Uhuru Kenyatta that is live from State House, and it has already started, I think, from 7 a.m. And you can catch it on all KBC radio stations, that is Radio Taifa, English Service, Pwani FM, Shore FM, Mwago FM, Mwatu, Kitwek FM, Mayenga, Ingo, Minto, Iftin, Nosim FM, Eastern Service, Western Service, and Embu Service. These stations are also available countrywide on the Signet network on a free-to-air set-top boxes. So if you have or you're in these particular areas, you can have a listen in into what the president has to say in the state of the nation. And I know so many questions already trickling in, as State House has already tweeted on their Twitter handle, on the official Twitter handle, asking Kenyans, or rather inviting Kenyans, to give in their feedback in regard to the questions that they want the president to address during this particular live broadcast from State House. Now, various county administrations have sustained their onslaught against individuals defying government directives on curbing the coronavirus spread. Several people have been arrested in the last 24 hours and thrown into forced quarantine for violating the curfew put in place by the state. This coming amid a launch of campaign to celebrate frontline workers in the war against COVID-19. Beatrice Gatonya reports.
5 more people have been placed on a 14-day forced quarantine in Nakuru County for flouting government guidelines and directives put in place to curb the spread of COVID-19. Nakuru County Commissioner Erastus Mbui Mwenda noted that the culprits will be arraigned in court as soon as their time in solitary isolation comes to an end. Authorities are concerned that the suspects came into contact with a person who succumbed to COVID-19.
After completion of the quarantine period, whether they are positive or not positive, because they will have to be subjected to test, they will also face a legal action for violation of directives.
We therefore want to take this opportunity to urge the community living in these areas to be extra vigilant in managing these visitors who come from areas that have previously had high cases of infection.
In Nyeri, 23 people who were arrested at a guest house while imbibing alcohol have been arraigned in court and charged with the offense of contravening COVID-19 regulations. The suspects who were charged before Nyeri Chief Magistrate Wendy Kagendo included Ruare Ward MCA Paul Kanyari. In Karissa, 27 passengers suspected to have traveled from Nairobi have been put under a forced quarantine facility at the region's referral hospital. The number of those apprehended and thrown into quarantine in the area now stands at 31 after 4 others using private vehicles were arrested. Karissa County Commissioner Meru Mwangi has warned bus companies against colluding with unscrupulous businessmen to breach law and order. Meanwhile, a section of Uasin Gishu residents have raised concern over rising cases of insecurity as the fight against the pandemic continues. While calling for increased security in the area, the locals disclosed that criminals have been breaking into their shops, taking away their business commodities during curfew hours.
Sasa sisi watu wa Munyaka kweli kabisa hatuna ulinzi wa kutosha. Wakati ambao askari wanatuambia tuingie saa moja, watu wako ndani ya nyumba. Lakini baada ya kuingia wanabaki nje, lakini hatujui kazi kwa hakika ambao wanafanya.
Wizi kila saa, leo wanakuja huku, kesho wanakuja huku. Hatulali. Tukiingia tu kwa manyumba baada ya kafi, tukikaa wanakuja wanaanza kuvunja mamilango.
Tunaomba askari wetu na OCS wetu wakubali kufanya kazi ama na watukubalie sisi tunaweza linda mali yetu. Tuwe na vigilante team ambao wanaweza shikana na askari ili tukisikia nduru mahali tunaweza saidia mwenye amepata na hiyo shida.
Parliament in the meantime will audit billions of shillings donated towards the fight against the spread of COVID-19 following reports that some persons and government institutions were misappropriating the funds. Gilgil MP Martha Wangari says Parliament must play its oversight role in making sure that the funds are well utilized and used for the intended functions.
Kazi yetu ni ku-oversight vile zitatumika na tutakuwa macho. Tujue ni pesa ngapi zimewekwa hapo. Nimeona mpaka IBC siku hizi wana contribute. Sikujua wako na hadi budget. Ofisi ya DPP wana contribute millions of money. Hiyo pesa yote ndio iende kwa kutumika kwa kupea watu chakula, kupea watu masks.
And former Kakamega Senator Boni Khalwale is calling on the county governments to stop taking levies in order to cushion Kenyans from the economic effects of COVID-19.
We would like Governor Paranya to waive all domestic bills pertaining to water, electricity, rent, so that our people can focus on treating themselves and feeding their families.
And finally, editors have joined hands with the healthcare sector players to boost the war against COVID-19. The hashtag Sasita campaign encourages all to pause at midday to celebrate frontline workers in the war against COVID-19. Every Wednesday at noon, people are asked to pause to clap for healthcare providers, journalists, police officers, and others on the frontline as a sign of solidarity with the important work they are doing.
The Kenya Editors Guild Association, together with the Kenya Medical Association and the Association of Nurses, has initiated a campaign dubbed Saa Sita. In this campaign, at midday, every Wednesday, we will all stop and clap for all our healthcare workers. And this is a campaign that is being rolled out in different countries across the world.
Now, still keeping up with matters of COVID and crossing over to Mombasa is that 12 people have so far tested positive for COVID-19 virus at the port of Mombasa after 5 more cases were recorded over the weekend. Now, the 5 were part of the 229 persons who were tested by the close of Sunday, following a mandatory mass testing exercise that kicked off on Wednesday last week. And as our reporter Karissa reports, is that 1,000 workers at the facility are expected to undergo the mandatory exercise that is expected to last 1 week. Now, that is what is happening down in Mombasa. How about we go to the corridors of justice, where Chief Justice David Maraga says courts will remain closed amid sustained calls for them to reopen in what he says is part of judiciary efforts to protect its staff and Kenyans from contracting the coronavirus. According to Maraga, the National Council and Administration of Justice has, however, directed courts to continue hearing certain matters through use of technology.
Amid calls to have the judiciary fully resume its operations, Chief Justice David Maraga maintains that his office will not expose the judicial staff and the public to the deadly coronavirus.
There is no point of us saying that you can go on with the activities as usual and the next day you are not there or your family is not there. Let us all keep safe. We know that this is affecting the court users a lot, but I'm sure everybody understands the situation in which we are.
According to Maraga, the National Council on Administrative Justice has been closely monitoring developments on COVID-19 and as such reopening of courts will be detrimental to the gains made in efforts aimed at curbing the spread of the disease.
Both the bench and the bar, as well as some court users, comprise many senior members who fall within the category, the category that is considered most vulnerable to COVID-19. Scheduling open court hearings and requiring them to appear personally in court will be putting them in harm's way.
Maraga says the council is scaling up the use of technology to ensure judgments on urgent matters are delivered to reduce backlog of cases.
Except in exceptional circumstances, all pleadings are being filed and served electronically. This shall remain the case for the time being. Presiding judges and heads of court stations are requested to meet with their stakeholders to determine which matters can be heard and determined remotely.
Courts which have been carrying out open sitting setting despite carrying out major criminal offences are also expected to rule on minor offences within 24 hours.
Criminal cases shall continue to be presented to court for plea taking. On the other hand, police shall continue to release minor offenders on bond or bail, failing which they must take them to court within 24 hours.
The decision by the council is said to have been informed by a joint letter in which 3 associations representing the judiciary staff, Kenya Judges Welfare Association, Kenya Magistrates and Judges Association of Kenya, as well as Kenya Judiciary Staff Association, informed the Chief Justice that their well-being and health was paramount as the nation battles the effects of COVID-19. Reporting for Channel 1 News, I'm Gladys Mungai.
A campaign meant to sensitize young people living within the city's informal settlements on the novel coronavirus has been launched in Majengo slums. The latest development coming amid revelations that COVID-19 infections are now community spread, with fears that the obtaining situation could have devastating consequences among vulnerable populations.
With majority of city dwellers living in congested shanties, the concept of social distancing and hygiene remains a myth for many. The World Health Organization reports that 60% of urban dwellers live in overcrowded places without water and proper sanitation. An obtaining situation that has prompted a group of youth from the capital to launch a sensitization campaign to create awareness on how to combat the coronavirus pandemic among those living in the slums. Led by Kenyan Bollywood actress Nadia Abdi, the group says it targeted slums as the pandemic poses particular risk for people living in informal urban settlements, and transmission of the virus is more likely.
Today we are here in Majengo to create awareness about COVID-19. It's really a serious virus that has affected a lot of us, so that's why we are here. And as a token, we have brought some little charity that we could afford as Tosha in partnership with Esther to come and give them something small that they can push them ahead.
We are seeing a lot of people not having face masks, and there's a bit of not a better word used, ignorance. Guys are not having a mask, the social distance. So we have come here to educate them, to give them the empowerment that through all these challenges that we face as individuals, as a country, we are here to stand with them.
The initiative that saw area residents sensitized on best practices as well as viable guidelines saw locals receive face masks, sanitizers and food supplies, a development that was uploaded by beneficiaries.
Wamekuja kututembelea, wametuonesha jinsi ya kunawa mikono, jinsi ya kukeep distance, jinsi ya kuvaa mask, umuhimu wake, na pia walichotuletea kidogo si haba, itatusaidia.
Those behind the initiative took the chance to urge Kenyans to follow guidelines issued by the Ministry of Health aimed at containing the spread of the deadly virus.
By you protecting yourself, it's helping us. See, create a 1.5 meter, wear gloves, wear your mask, stay indoors. If you have nothing to do outside, just be indoors.
Now, focusing on matters agriculture is that the Cabinet Secretary Peter Munya is on the spot for allegedly excluding some counties that grow coffee from the recently launched Coffee Revitalization Fund. Now, senators drawn from Western Kenya and South Rift protested in the House, flouting the allocation of 1.5 billion shillings in the counties to Central Kenya. Now, Munya is expected before the Senate Agriculture Committee by the end of the week. That was what was happening yesterday. Remember, the sittings with Senate were taking place, and one of the things that have come up is the issue of coffee. Now, still keeping up with updates on coronavirus, that 5 months after the first case of COVID-19 was reported, the world now has over 2.5 million positive cases and at least 172,000 deaths. Now, the exponential growth of the virus across the globe has presented the biggest headache yet for health experts in Kenya and indeed the world. Our reporter Caroline Kamau engaged a leading virologist and immunologist to understand more of the virus that has left scientists burning the midnight oil to find a vaccine.
Thank you so much for joining us. My name is Caroline Kamau. We'll continue with the conversation on the COVID-19. It's a disease that was first reported in Wuhan, China last year. Right now we are at over 2.4 million people globally. The disease is highly infectious, and today we will be talking to a virologist in the country, Professor Omu Anzala. He's one of the lead virologists and immunologists in the country. He'll shed more light on this virus. Daktari, thank you so much for joining us.
Pleasure.
All right, so we'll get right into it. The coronavirus and its resemblance, for example, to SARS and to MERS. These are diseases that were there in early 2000, but they were dealt with very quickly. What is so different about COVID-19, and why is the rate of infection very, very high?
The coronaviruses are not new. These are viruses that occur in humans, because there are 4 human coronaviruses. If you include SARS that occurred in 2002, and if you include MERS that occurred in 2003, then we are saying there are 6 human coronaviruses. And then the wild animals have a lot of other coronaviruses. The difference between this virus, coronavirus now, and the human coronaviruses, the 4 common human coronaviruses, and SARS and MERS, is that this particular one is much more infectious than previously seen with the other 2. It's much, much more infectious. Number 2, it also causes more severe disease among a segment of population, and hence the difference between this particular coronavirus and the 6 coronaviruses that we already know that cause problems in humans.
Why would you say it's more infectious? What is it about this virus?
It is more infectious because, for one, we believe the way it is spread. For one, it's spread through a droplet infection. But it is also spread by the droplets landing on the surfaces, and these viruses surviving on the surfaces for a slightly longer time. So that not only are you exposed through a droplet infection from somebody who is infected, but you are also exposed by touching surfaces that are contaminated by these droplets and touching your face or your eyes. So it has all these modalities of infection. And what we know now is that it can exist on surfaces for 2 to 3 hours or even 6 hours, hence making it more contagious. Yes.
We've heard, of course, from doctors the aggression this virus has, especially on the elderly.
Yes.
And of course, explanations around that has been sometimes these people have conditions that they're dealing with.
Yeah.
However, just make us understand what happens to a human body, the immune system of a human body, as we grow older, so that then they become more susceptible to this disease.
Actually, there are 2 aspects, and it is a word that we use in science called immunosenescence. Immunosenescence means aging of the immune system. As we grow older, the immune system ages as well. And as the immune system ages, it becomes weaker and weaker in terms of its ability to respond to infections, inability to respond to tumors. That is number one. Number two, comorbidities. These are infections that come to us, like diabetes, like hypertension, all right? Things of that nature also happen to weaken the immune system. So this virus seems to thrive in those individuals who are elderly because of the weak immune system. But at the same time, those who have comorbidities, because these comorbidities, the hypertension, the diabetes, and all these other conditions also weaken the immune system. And that's why we see those who are passing away tend to be the elderly, and if they are young, tend to be those who have all these other surrounding conditions.
So is there anything that an older person can do to boost the immune system?
Yes, the one thing is that what we are now recommending is that ensure that people in that age bracket are protected. So if they live in a home for the elderly, that home should totally be locked out from normal individuals. They should all ensure they observe distancing. They should all sanitize. The place should totally be clean. But at the same time, let them ensure that their comorbidities are taken care of properly. If it's hypertension, it's managed. If it is diabetes, it is managed. And if it is any of these conditions are properly managed. But the whole issue is to ensure that they are totally prevented from getting what? Getting infected. Yes.
Let's get into the vaccine that people feel, or the treatment that people feel is taking a little longer than they would hope to treat this COVID-19. However, in the country, much as we have 281 cases as of yesterday, we have several people who have recovered as well. So the question being, there's no vaccine, there's no treatment, but we are recording recovery.
Yes.
What is happening there?
Actually, that is exactly how viruses occur. Majority of viruses that we get infected with, usually our immune system, when it's up and working properly, majority of us recover. We get infected with measles, we recover. We get infected with hepatitis B, we recover. We get infected with hepatitis C, we recover. We might develop mild symptoms where you might be given painkillers and maybe fluids. But what these are doing is they are aiding the immune system to respond and get rid of the virus. So recovery is actually a very good thing, because recovery also begins to teach the scientists how the immune system reacted to get rid of the virus to lead to that recovery. And that is the information that is used to then develop a vaccine. Realize that the previous 6 coronaviruses, there is no treatment. Realize also for the 6 coronaviruses, there is no vaccine. This particular coronavirus has only been with us for a period of what? Of 4 or 5 months. So when I hear people saying it's taking too long, I'm surprised, because from the time the vaccine was, from the time the virus was isolated, within 2 months, a test was developed to be able to test and say this person is infected or not. All right? That was unprecedented. A period of only what? 2 months. Now we are looking at various drugs that have been said could work. Clinical trials are being done. We are also looking at vaccines. Okay? Research and development is going on. So it has only been 3 months. What we can actually say is that let's observe the measures that have been put in place, so that we give ourselves time to find a proper treatment, and also give ourselves time to actually find a vaccine.
I think, Daktari, if I could just add into that, I know the frustration of most Kenyans, the frustration of people in Nairobi, for example, is the guidelines that have been issued. Okay? We are told to stay at home. Social distance. These are things that it's a new normal, it's being called.
Completely.
So I think this is the frustration of most Kenyans. The 4 months is too long for most Kenyans. How much longer can we?
I wish I knew. I totally wish I knew how long it's going to take for us to find all these things. But look at China. China is never the same. All right? From the time COVID started in last year up to now, even when they are beginning to say they are opening up Wuhan, China is not going to be the same. And I can assure you now that the world is not going to be the same again. So the whole idea now is that let us observe the measures that have been put in place very critically, okay, as we try to understand this virus very, very well, all right? So those measures will continue. They are not easy for anyone. Don't even think that those of us who are scientists think that those measures are easy. They are difficult for all of us. Washing hands, social distancing, sanity, putting on masks, and you have no idea whether it is for 2 weeks or for 3 months or for 6 months. So what I can say is that let's just observe those and let's give the scientists and the communities and those who are involved in looking for cure, looking for vaccines, time to really work very, very hard to ensure that it doesn't take much longer than it has already taken.
So let's just adjust to
totally. As you've said, it's a new normal. Yeah. All right? And things don't change things don't just change. Things change for a reason. So we are changing because, as I would say, we are at war. And we know the enemy, but we don't know the enemy very well. Very well. All right? That is actually the position we find ourselves in.
Professor, thank you so much for your time.
That's
Professor Omu Anzela, one of the lead virologists and immunologists here in the country, saying that we know the enemy, but we do not know the enemy very well. The enemy might be here for a little longer, so let's just adjust accordingly and be patient as the scientists in the country and of course across the world try to figure out the vaccine, the treatment for this virus. My name is Caroline Kamau. Back to you in the studio.
I hope you have learned something about how to take care of yourself during these uncertain times, courtesy of the pandemic COVID-19. Now, as the number of infected persons in the country hit 296 as per yesterday, the question as to the potential future health implications for those who have tested positive for COVID-19 are abound. And with studies on whether pregnant women with COVID-19 can pass the virus onto their fetus or baby during pregnancy or delivery are inconclusive, women remained worried about contracting the virus and transmitting it to their unborn children. Now, in today's edition of the Corona Fact Sheet, we explore the risk factors for pregnant women.
A lot of questions have been asked on whether a mother can transmit the virus to the unborn child in her womb. And so far, there has been no evidence of this. There's still some research ongoing, and the scientists will be able to tell us more definitively if this is actually happening. But to the best of our knowledge, there's no evidence that this newborn child can get coronavirus from the mother in the womb. However, mothers are a bit vulnerable to getting COVID-19 because when a mother is pregnant, this makes them have an element of lowered immunity. So they are more vulnerable. And so pregnant mothers are encouraged to stay at home, to work from home, and to avoid generally public places where they can be exposed to this virus.
Now, crossing over to the counties, that a section of leaders from Western Kenya sugar belt have joined farmers in faulting the importation of sugar from the East African countries. Now, a week after the government issued a go ahead of allowing the importation of the product to boost the sugar supply in the country. Now, the leaders maintain that importation of sugar will kill local industries. Now, details of this and other highlights from the county news roundup.
A section of leaders drawn from the Western Kenya sugar belt have joined the sugarcane farmers from the region in challenging the importation of sugar from the East African countries over what they term as a move that will kill local industries. Their plea comes after the government issued a go-ahead to allow importation of the product to boost the sugar supply in the country. The leaders maintain that the Western region has a capacity to produce enough sugar for the nation.
Tulikuwa hata kupitia kwa ofisi zingine tumepitisha ujumbe kwamba kuna hili kero ambalo linakuja, na hata vile nilikwambia niko na information hata records ambazo tukimaliza mkutano huu naenda kwa mkutano mwingine na gavana kumweleza haya mambo ambayo yanaendelea.
Inakuwa ngumu kusema ya kwamba naenda kwa factory na wanasema hakuna mahali tunapeleka sukari. Kumbe laini ilikuwa imetokea upande ya Uganda.
Nataka factory zetu zitoa sukari na indeed zinatoa sukari ya kutosha Kenya mzima.
Elsewhere, residents of Kariobangi South are calling on Kenya Power to investigate a landlord whom they accuse of using illegal electricity connection, which is damaging their electronic gadgets. The residents say that their complaints have been met with threats and forceful evictions.
Mahali tunaishi hapa kwa hii plot, stima ni ya wizi, huwa anatuambia ni ya mulika. So inakuja na moto mwingi, mara imechoma vitu zetu zote, hata watu wote wako hapa wamechomekewa. So wakati mimi nilienda kucomplain, nikamwambia nilipe vitu zangu zile nimechomekewa nazo Raudi, akasema hawezi kubali. Akaniambia badala tu nimlipishe, akanipatia wakati, akaniambia mimi ni hame, amenipatia tarehe moja ni hame.
Meanwhile, a boda operator based in Non-Kopir area of Kitengela town in Kajiado County has been evicted from his house for failing to pay monthly rent worth 11,000 shillings and is forced to seek shelter at a deserted kiosk. Davis Odhiambo is calling on well-wishers to come to his rescue.
Kwa sasa hivi hakuna kazi. Mwenyewe naye anahitaji pesa zake za bodaboda. Ukifanikiwa 300, hiyo ingine pengine umefanikiwa hata 50, hiyo 50 ndio sapa, hiyo 50 ndio lunch.
It is, however, a different script in Emaroro town in Kajiado East, as John Olemoiko has taken a different approach, waiving rent in both his residential and business premises for 2 months to cushion tenants against the effects of COVID-19.
Nyumba tunalipanga 5,000 na stima mwenyewe analipa kando. Umetuambia tusilipe, atatulipia.
Ikiendelea tena, tutakaa chini tena, nipatie nafasi ya mwezi mwingine moja, at least ndio wapate shida, kwa sababu watu ni watu ambao wanafanya biashara, ni wakaaji ambao wanakaa mahali mbali.
Finally, residents of Botenga area of South Mugirango constituency are up in arms over the poor state of roads linking the area. The irate residents decry untold suffering occasioned by difficulty in movement by both people and goods via the Nduru Rongo University Road.
Wengi wanajua hii barabara iliwekwa ramu, lakini saa hii mnaona ni masimu tu yameendelea huko hapa, magari yanakwama, na hii barabara ina connect Nduru Secondary na Rongo University.
Now, I'm sure you have been waiting to have a listen into President Uhuru Kenyatta as he addresses a few issues, especially around the state of preparedness on what the government is doing during this COVID-19 pandemic. Now, just to tell you that that particular interview is live now, and it's being broadcast on all KBC stations, radio stations at that is Radio Taifa, English Service, Pwani FM, Mwato FM, Mwago FM, Shoro FM, Kitwek, Minto, Mayenga, Ingo, Iftin, Mnosin FM, and Eastern Service, as well as Western Service and the Embu Service. Further, these are available on the free-to-air Signet on the set-top boxes. So get onto your frequency of your choice, have a listen in, and remember, since we are broadcasting this live, we would also appreciate your feedback, and if you have any questions directed to President Uhuru Kenyatta, the hashtag is Commercial Corona, and our Twitter handle is at KBC Channel 1 TV. On Twitter at KBC Channel 1 TV, and our SMS line is 2154. Especially get on Twitter, because on the official State House Twitter handle, that is State House Kenya, at State House Kenya, you can get tweeting and send those particular questions that you have pertaining how the government is especially handling issues around COVID-19 to Twitter directly. So get tweeting, give feedback, ask the questions that you want, and give the responses that you would want to see the government put in place, especially in measures. Remember, Kenyans are already being reported to escape a quarantine, saying that those situations, or rather quarantine centers and facilities, are not at par in terms of service. So if you have those questions, remember, we are broadcasting live in all KBC stations, and it's also available on Signet on the free-to-air. Now, crossing over to matters business is that the government is looking up to local manufacturers to sharply ramp up production of personal protective equipment and ventilators to meet demand as the spread of coronavirus pandemic persists. Industrialization, Trade and Enterprise Development Cabinet Secretary Betty Maina has, however, called on manufacturers to refine the products to meet global standards. She was speaking when she received a prototype ventilator manufactured by the Kenya Association of Manufacturers Automotive Sector.
A bit like your phone. Yeah, so you have like a touchscreen here.
This locally made ventilator is yet another feat by local manufacturers targeting to assist the government in the war against coronavirus pandemic. The machine is vital in treating COVID-19 patients in critical condition. Currently, Kenya urgently needs at least 1,511 intensive care unit beds and 1,609 ventilators to care for a possible 1 million COVID-19 cases.
Looking at the ventilator, listening to it as it, pants away in the background, shows at least quite a bit of work has gone into that. And I'm excited that you have worked with the Bureau of Standards, you have worked with the medical professions to be able to ensure that you can develop this product to the satisfaction of the end users.
Speaking during the unveiling of a prototype ventilator manufactured by the Kenya Association of Manufacturers Automotive Sector, Industrialization CS Betty Maina commended the local manufacturers, saying the country is looking for a scenario of continued partnership even after the pandemic.
And I certainly hope that after the height of the pandemic is over, whenever that will be, that we shall not forget our innovativeness, and we will actually take some of these ideas to full commercial production and explore new areas of business.
I think if these collaborations continue into the future, the industry is very keen to be very innovative. We are currently even working on the rebound strategy as the Kenya Association of Manufacturers for the manufacturing sector, and we'll be working closely with the Ministry of Industry to look at opportunities for import substitution, opportunities for things we can manufacture locally which we are currently importing.
On her part, the Kenya Association of Manufacturers Chief Executive Phyllis Wakiaga said pending approval by the Kenya Bureau of Standards, Kenya manufacturers were well on their way to meeting the country's demand for health equipment during the global health crisis.
No, we've gotten very good support from the government through the journey, and I'm sure even as we commercialize and move forward, we'll get a lot more of that. I think we heard what the CS said. We've been keen to see how Kenya as a country can go into higher levels of manufacturing or new products that are not manufactured within the region. And this is those steps we are making to say that these are certain areas that Kenya as a more advanced manufacturing economy can start to get into.
According to a study jointly carried out by researchers from the Kenya Medical Research Institute and Oxford University this month, only 13% of health facilities in the country have the crucial items to support a COVID-19 patient, including medicines, oxygen tubes and inhalers. Behold a locally manufactured ventilator machine, probably the best example of what can happen when the government sector and the private sector come together to slay the dragon that we now know as a COVID-19. Alana Oko, Channel 1 News.
Kenya is rising. Buy Kenya, build Kenya. Maybe this is a time that necessity has driven us to think outside the box, or that there is no box at all, that we can actually provide what we need during this pandemic. Now, claims linking the fifth generation network to coronavirus are unfounded. These are sentiments of ICT Principal Secretary Jerome Ocheng, who says there is no scientific data linking the deadly virus to the deployment of fifth generation mobile technology. Now, in an exclusive interview with KBC Channel 1, the PS added that Kenya has begun 5G trials in the 2.6 and 3.5 gigahertz frequency bands.
Kenya is inching closer to fifth generation mobile internet technology, with 7 firms already ongoing, or rather undertaking trials with an aim of rolling out. This is according to the Acting Director General, Mercy Wanjao, at the Communications Authority of Kenya. The fifth generation network is promising to deliver super fast internet speed, stable downloads, streaming and connectivity once
fully deployed. Despite the backing to revitalize the telecommunications on a global scale, theories have emerged linking 5G rollout to the deadly coronavirus pandemic.
From a technical perspective, I say for sure these are, would describe them as conspiracy theories.
Some theorists claim that 5G damages the immune system, leaving the affected individuals highly exposed to the disease, while others claim that 5G mobile networks are being deployed in high-frequency bands of up to 60 gigahertz, thus causing ionization of the oxygen molecules in the air.
Also realize that there are so many other countries that have not even tested 5G, and yet we still have corona deaths. So, I mean, I looked at that and I actually said, I mean, from a technology perspective, I see no relationship whatsoever between a virus that's causing corona and the issues of 5G as a technology.
ICTPS Jerome Ochieng revealed that plans are at an advanced stage to deploy 5G network in the country, with trials already underway in the 2.6 and 3.5 gigahertz frequency bands.
So we are saying, in terms of facilitating government services, then technology has played a very important role, or ICTs have played a very important role. Secondly, learning. A lot of institutions are now providing their learning online through the various platforms.
The rollout of 5G will provide higher speeds and a better connectivity, mitigating the concerns of individuals who avoid transacting on their phones due to slow connections. In the coming weeks, the country is to attain 100% internet connectivity through the Google Loon Telecom project.
The 100% coverage across the whole country, because as opposed to masts that we normally have on the ground, here we have balloons that are actually now providing internet access from the top, which means areas that were traditionally disadvantaged because of their existing infrastructure are now advantaged because it is now the reverse.
Once 5G is deployed, Kenya will become the fourth African country to launch 5G networks using the Huawei technology, following South Africa, Egypt and Uganda.
I'm Regina Manyara-Gital reporting for Channel 1 Business.
Well, that was yesterday where the PS of ICT had come to just talk about government's efforts in, just supporting government's efforts during this COVID-19 situation, and saying that ICT, you should take the advantage of the current ICT infrastructure to ensure that you work from home if you can. And also added that essential service providers need also to adhere to the laid down measures to stop the spread of coronavirus. Now, still keeping up on matters of business, that Kenya's budget deficit is expected to worsen this year due to low revenue and spiking debt obligations. Rating agency Augusto & Company says deficit will jump to up to 13.8% this year, while debt service to revenue will tank to 30%. The agency has further lowered Kenya's economic outlook to negative, with the growth expected to halve in 2020.
Worsening macroeconomic activity has thrown a spanner into the works of Treasury mandarins. Treasury had planned to gradually lower the gap between the revenue and expenditure to 3% by the year 2024. Kenya's fiscal deficit, which peaked at 9.1% of GDP in the year 2016-2017, is estimated to be 6.3% in the current fiscal year. But a worsening macroeconomic activity due to the coronavirus pandemic and the low-cost innovation is proving a major headache for economic planners. Rating agency Augusto & Company says Kenya's budget deficit will rise to a 10-year record of 13.8%, exacerbated by higher spending and low revenue.
We are also now going to reallocate funds from travels, funds from some development projects, so that we can now manage. And moving forward, it's clear that our revenue streams are going to shrink. By how much, we're still studying.
Already, Treasury has lowered its 2020 economic growth projection to 3.5%, majorly due to the coronavirus pandemic that has disrupted the global supply chain. The credit rating agency has given Kenya a negative outlook for this year. The agency notes that pressure on agricultural exports, tourism activities, locust invasion and COVID-19 could cut Kenya's domestic product growth to 3.5% in 2020.
This year we're looking at a growth of about 6% of GDP, but this will drastically drop to about 3 or even less. But we are going to give a firm figure when we'll have taken it on board, the impact of this maybe in the next 1 month.
Driven by these economic factors, Agosto expects Kenya's debt service to revenue in 2020 to be twice the recommended 30% threshold by the International Monetary Fund, which will put a strain on planned development expenditure and the country's ability to fight COVID-19 should there be a widespread outbreak in the country.
Now, still keeping up with matters of COVID-19 is that active coronavirus cases across the globe has exceeded 2.5 million people, with the death toll now rising to 174,000. Now, the U.S. has by far the largest number of cases, with more than 787,000 confirmed infections and about a quarter of all the fatalities, to 42,000 of its citizens succumbing to the disease. Spain and Italy are the worst hit European countries, with each recording more than 20,000 deaths. Emily K. Boda with the details of that.
Coronavirus is spreading rapidly in many countries, and the death toll is still climbing. In the United States, President Donald Trump has said he will sign an executive order to temporarily suspend all immigration to the U.S. due to the disease outbreak. Trump's declaration coming as the U.S. death toll went beyond 42,000, with over 792,000 confirmed cases. And as many countries seek an end or partial end to their lockdowns, the World Health Organization has once again given a warning that this should be a gradual process, arguing that premature relaxation may lead to a surge of new COVID-19 infections. In Europe, Italy will this week announce plans for the gradual reopening from a lockdown imposed to fight the coronavirus emergency that will be applied starting May 4th. France has become the latest country to record more than 20,000 deaths related to coronavirus. Germany has, however, reopened small shops, car dealerships and bicycle stores in a tentative easing of the coronavirus lockdown imposed nearly a month ago. The United Kingdom Parliament also resumed on Tuesday, with lawmakers being asked to approve a new hybrid system which will limit the number of people allowed in the House of Commons at any one time. In Asia, the semi-autonomous Chinese city of Hong Kong reported no new cases yesterday, raising hopes that the second wave seen in March could be over. In Africa, Ghanaians welcomed the end of the lockdown with mixed emotions. While some Ghanaians were relieved to get back to work, others were left fretting after the country became the first in Africa to lift a coronavirus lockdown. For Channel 1 News, I am Emily K. Bade.
Now that was the statistics yesterday. So 24 hours, around 12 hours or so have passed. How about we get updated on what is happening across the globe? Because this is a global pandemic and uncertainty is rife across the whole world, with that the cure or a vaccine is still out of humanity's reach. Over to you, Doreen. What are the statistics this morning?
Exactly, and we'll be moving to see how the globe is looking like in terms of the statistics. Of course, that means especially in European countries where Italy and Spain really just records high number of these cases. But before we get to do that, let's just begin with the African continent. Remember, yesterday when you're looking at the numbers, South Africa was topping the list in terms of the number of confirmed cases here in the African continent. But as of today, it is Egypt with over 3,000 cases. But even at that, in as much as, yes, Egypt has the highest number of cases, it does not have the highest number of death cases. So Egypt has over 3,000 death cases, followed very closely by South Africa. And as I had mentioned, South Africa was topping the list yesterday, but today it comes in second, which of course still just shows that it still has high numbers of confirmed cases in terms of this disease. And of course, it is followed by Morocco. In fact, the three African countries with over 3,000 cases is Egypt, South Africa, and Morocco. But interestingly, in as much as, yes, they have the highest cases in terms of confirmed cases, but they do not have the highest cases in terms of death cases. But even at that, it is also closely followed by Algeria, Cameroon, and Ghana, which have over 1,000 cases. So this 5 countries have over 1,000 confirmed cases of this disease. But like I mentioned, they do not have the highest number of death cases. They just have the highest number of confirmed cases. Remember also yesterday, Tanzania was recording high cases in just 24 hours, over 84 cases. This was on Monday. Still, recording high cases in East Africa. Kenya, where we stand as of now, we stand at 296 with 15 more confirmed cases as of yesterday. So let's just look at the country that is recording high number of death cases in as far as this disease is this coronavirus disease is concerned, and this is Algeria. Now, Algeria records about over 2,000 confirmed cases with a total of about 384 death cases. Of course, that just shows you that, yes, Egypt was recording high number of confirmed cases, but on the other hand, Algeria comes in with the highest number of death cases. So that means in as much as, yes, a country may be recording high number of confirmed cases, that does not translate to ultimately mean that it will record high number of death cases. So that's just where we stand. Of course, probably in the later in the segment where we continue updating you on matters COVID-19, we'll be looking at now the number of recovery cases and looking at which country across the globe is recording high number of recovery cases, and also specifically here in Africa. But as of now, where we stand in the entire African continent is at 24,209 confirmed cases in the entire African continent. The total new cases so far stands at plus 38 cases. Total number of deaths so far is at over 1,000, specifically 1,164 total deaths so far. Total number of recoveries stands at 6,471, which ultimately translates to the number of active cases standing at 16,574. So that is where we stand as of now in the entire African continent. And the lowest country in the number of confirmed cases, the lowest country recording this confirmed cases, it's South Sudan with just 4 cases. Remember, like I mentioned, in Kenya, we now stand at 296 confirmed cases with 15 more, which were mentioned yesterday. So we'll continue to give you updates of this coronavirus, looking at how the African continent is doing in terms of these cases, the kind of measures different African countries are trying to put in place to ensure they contain the spread of this disease. So in as much as, yes, as an African continent, we're not recording so much compared to the European continents or other continents, but even at that, we're still recording cases. So we'll be looking at some of the things that the African leaders and different African countries are trying to do to ensure that there's best contain this disease. And even at that, we'll be looking at the number of recovery cases in regards to this disease, just to continue putting some ray of hope, especially for persons that are still fearful in this disease. So now let's move to our In the Headlines segment. And as it is tradition, we begin with the People's Daily. This is the front page of the People's Daily. The caption here reads, Nairobi, Mombasa risk total lockdown. So this is a statement that was said by given by the PS Secretary Karanja Kibisho, and this is what he said. So the Interior PS says that government will impose more stringent measures as he blames the business as usual attitude in 2 COVID-19 epicenters for alarming rise in virus infections, which reaches 296 as of yesterday, with 15 cases confirmed. This story has been well fleshed out from page 4 all through page 16. Also on the sidebar, there's the numbers have been given there, with 296 cases so far here in the country. 74 recoveries, 15 deaths. Like I had mentioned, 15 more cases as of yesterday. And of course, this 15 cases comprises of 7 males and 8 females. Now, of these 296, 206 cases are in Nairobi County, 61 cases in Mombasa County. So far, they have tested 14,417 samples. So, of course, this just shows you how Nairobi and Mombasa really are leading in terms of the number of confirmed cases. Also, on the front page of the same paper, we have the issue of flooding, and 10 more die in flooding mayhem. Of course, we'll continue to see, we'll unpack more of what is being said in terms of this flooding and how Kenyans need to take care of themselves even as the rains continues. But now, onto a story that was on the front page of the paper, and this is in regards to the total lockdown of Nairobi and Mombasa cities as it has just been anticipated. And so the government is now considering more restrictions in Nairobi and Mombasa next week. Keynote next week in a bid to contain the steady rise in the number of people infected by coronavirus, with confirmed cases rising to 296 as of yesterday, 14 deaths. The Interior CS disclosed that the coronavirus emergency management team was discussing stricter measures to contain the spread of the virus that has already moved to the community transmission stage. Remember, more of what was being said, or better still is being said, it is now that the disease has moved to more into the communities and even more away from the main city centers, even now into the rural setup. So now they're considering more stringent measures, and this is on both the major counties that are now being regarded to as the epicenters of this disease, which is Nairobi and Mombasa. Jane.
To the Daily Nation, let's start with one story that has been making headway on social media and also on mainstream media. And this is in regards to the prison break, quote unquote, that we saw yesterday. There has been a video that has been circulating across social media platforms of some individuals who were seen escaping the quarantine facility that is the Kenya Medical Training College. So here on the front page of the Daily Nation, we have pictured therein the CAS of Health, that is Mercy Mwangangi, where, she was just speaking. And of course, there it talks about, or rather it questions, how did they escape from quarantine? And this story has further been written, or rather looked into in the Daily. But getting to that story, let's just quickly get to that page that has this story. It has been called Prison Break. Kenyans under quarantine at KMTC escape. When you get to read that story, it talks of how here they have mentioned that there is an unknown number of people in quarantine at the KMTC headquarters in Nairobi who escaped under unclear circumstances, considering the place is supposed to have been manned. They were seen climbing over the wall and landing on Bagathi Road. They were then said to later escape towards Nairobi West. Now, the facility is housing more than 200 people who were found through contact tracing or arrested for flouting the curfew and social distancing rule, which, of course, the CS for Health said, once you're found past curfew hours, you're going to be considered exposed. So among those who are in this quarantine facility are those who were also found outside past curfew hours. But there's also said to be some who have believed to have escaped on a Monday night by taking advantage of the heavy rains that we were experiencing, and also the fact that, enforcement agencies were distracted by the morning activities during a breakfast hour. Now, looking at the claims that have been made by those who are in this isolation unit, they say that when we lined up for food, and this is one person who was interviewed and requested anonymity, this person said that when we lined up for food, they could be heard saying that the 2,000 per day rate was too expensive. These were the words of one person who was interviewed, but the health ministry officials say that they were aware of the escape and they are working with interior counterparts to track down the escapees. But now coming back to the state of the situation in this quarantine facility, some are saying, or still those who are in this facility are saying that, they look like typical dormitories. Just a bed. There's a bed with a mosquito net hanging over it, and the toilets and bathrooms are shared. And the centers are said to, elicit a lot of anxiety from waiting daily to be told whether they are positive or not. And this has affected the people emotionally and psychologically. And this is some of the reasons as to why, the reasons that are being put forth by those who are in this quarantine facility, could be one of the reasons that prompted these others to escape. But of course, the Ministry of Health is looking into that to understand the situation and get to track these escapees, because this is now a public health issue concern. At this point, if they had tested positive or if they were negative and had interacted with somebody who may have been positive but was unknown, that is a health risk for the rest of the public.
Now, maybe that's the reason, still on the Star this morning, that's the story that has been captured on page 2 of the Star this morning. And they've said on the Daily Nation that the number is unknown, but
Yes.
Star has gone on and said that 50 rebels scale walls, flee forced corona quarantine. Now, sources say they had complained about paying the 2,000 bob daily. Now, they say that they were arrested. The 50 had been arrested for failure to adhere to curfew regulations, and they're believed to have escaped on Monday night, taking advantage of the heavy rains to scale the walls, and their absence was realized yesterday morning when their colleagues went for breakfast. Now, quote unquote, from what CAS Messi Mwangaki has to say, is that she has warned the youth who are breaking curfew regulations on false belief that they cannot contract the disease. She said the young people are as susceptible to the disease as any other. Now, as this story continues trending, Kenyans have said, now, if you do not know why you need to stay at home, now you know, because there are people who are out there who are already in a quarantine facility who have escaped. Their whereabouts are still unknown, so it could be that person that you're seated next to in a matatu, or the person that you're shopping or rather going to the shopping mall with. And since we're talking about prison break, or rather prison break, quote unquote, in regard to that rebel issue, there's a story of how Kenyans are still showing their ingenuity. But now this is a case of wrong timing. Now, it's how Kenyans use bodas to circumvent Nairobi travel ban. That is on the Star this morning. Traders and other travelers on an average of 550 to cross over from Nakuru. Now, Kenyans seeking to travel in and out of Nairobi have resorted to back routes and bodas to reach their destinations. For example, travelers from Nakuru and Naivasha alight from matatus at Kwambira area in Limuru sub-county, about 2 kilometers to Kamandura. They take bodas through Kamirithu, Tharuni, Kiroe, Kerwa, and end up at Zambezi area in Kikuyu or Kikuyu town, where they then board vehicles to the city. That's it. So with this curfew and the lock-in of the Nairobi metropolitan area, Kenyans are still finding ways to creep in back into Nairobi, or rather Nairobi metropolitan area, bringing the questions, are we serious enough? And this is what the government is really saying, that we need to stop behaving as if everything is normal. That's a story that has been captured on the county's segment of the Star this morning. Just in relation to this issue of the prison break, is that Kenyans out there, you and I, you've been asked to adhere to the laid down stipulations so that we stem the spread of this pandemic that has infected over 2.5 million people globally, and over 174,000 people have died across the world. If that does not scare you, then the 50, or rather the unknown number, according to different sources, that escaped from quarantine should scare you enough to stay at home if you do not have to deliver essential services. That's a story that has been captured on the county segment of the Star this morning, and regard to also what it has been captured on the Star this morning, that also says that the disability groups are at risk and highlights on how they can protect themselves. That's the front page of the Star this morning.
And with me, I also have a copy of the Standard newspaper. And on the front page of the Standard, we have a different angle on the COVID-19 issue. Before I touch on prison break, on the isolation centers, let's head over to what's happening on the front page. We have an image of the health CS Mutahi Kagwe, and the splash there is broken promises, reality check. 40 days after the country recorded the first case of coronavirus, Kenyans want tangible solutions to win this war. Time is running out. There are 5 instances where we have coronavirus requires a clear roadmap to contain. That's number 1. Daily ledger of infections and deaths are not enough. Number 2, procure kits for mass testing to estimate the scale of the pandemic and the appropriate responses. Medical workers are the country's biggest asset. They must be protected and rewarded appropriately. Where's the money? and the resources mobilized from Kenyans and donors to fight pandemic. Number 5, public goodwill is priceless. Give Kenyans hope, not fear for the future. That is what is on the front page, broken promises. And just to open this page and get to see what it's all about inside the Standard, we have highlights on inside the 40 days of broken promises. When you have an image of the Chief Administrative Secretary, Mercy Mwangangi, addressing the press at Afya House in Nairobi yesterday. Kenyans now demand swift, tangible solutions rather than daily status update on states' handling of the coronavirus crisis. Kenyans remain anxious over when some semblance of normalcy will resume, but increasingly unmet pledges are a cause for concern. We have different views from different Kenyans, where we have Kenyans on social media and in the public spaces who are voicing their concerns on the government's response to the crisis and whether it will change its daily addresses from status updates to forums on the provision of more tangible solutions to what is turning out to be an essential threat to the country. Inside the 40 days of broken promises. That is what's happening in the Standard newspaper. But let me touch on the issue of the isolation wards and where we have the quarantine centers. And to pick it up from what's happening in Kenyatta University, in KU, we have a story by Faith Gashi, My 31 Days in KU's Isolation Wards. Why you should stay at home and take social distancing seriously. Faith Gashi arrived for work as usual. Hours later, her name was on the list of the latest coronavirus cases. My 31 days in KU's isolation wards. She gives her story, and from March 20th, when Faith Wangeshi reported to work as at a pharmacy in Nairobi's Buruburu Phase 2. Later on, she was taken in as a case in COVID-19 in the centers. She shares her story about how she spent her time in the isolation wards. But speaking of quarantine centers, yet we still have one story. Kenyan quarantine centers are in worse state than jails. State has isolation facilities at hotels, schools, and university hostels. The quote-unquote stay-at-home order has seen people lose their jobs, as well as they are faced with crippling bills to pay. And we have pictured in a section of Kenyans who were put in quarantine for 23 days after they arrived home from abroad. Kenyans' quarantine centers are in worse state than jails. Well, could this be the reason why we have people breaking out of the quarantine centers? Well, time will tell.
All right, let's get back to the Daily Nation. Now, speaking of the global scale through which we are seeing the cases that revolve around COVID-19, there is a piece here on the Daily Nation that talks about how women leaders shine in handling their country's coronavirus cases. And there's also some memes that have been circulating about countries that are actually having managing their coronavirus cases. They seem to be having something in common, and that is women leaders at the helm. But coming here, let me just sample a few of the countries that have been highlighted here. There are 7 countries that have been highlighted here that either have a female heads of state or in charge of the health docket. But here we start with Iceland, where the country is said to be offering free testing to all its citizens, which is said to be a key in case study in the true spread of coronavirus, and just to also track the fatality rates. The Prime Minister, that is Catherine, said there have been more than 100 tests per 1,000 people every day, and this has been far more than any other country in the world. And it is also said that there is an institution that has instituted a thorough tracking system to allow the country to keep business and schools open. They have so far recorded 10 deaths only, and they have not needed to go into lockdown. So business is still going on as usual, and schools have also not been shut because they have managed to contain the situation. Going to Norway, the Norwegian Prime Minister Erna Solberg is said to have held a dedicated press conference where no adults were allowed. She was only responding to children's questions from across the country, all in an effort to reassure them, just to keep them calm, let them know it's okay to be afraid, but they are doing all that they can, and of course employing empathy while at it to reassure the children of the situation. Going to Finland, we have Sanna Marin, who is said to have, or rather, did become the world's youngest head of state last year in December at the age of 34. Now, she has employed the use of social media influencers, and all this in an effort to just spread fact-based information on managing COVID-19, therefore putting an almost end to false information and untruths about COVID-19, therefore containing what information is being put out there. And finally, moving to Taiwan, we have Taiwan has been given its proximity to mainland China, they were expected to be heavily affected by this COVID-19 pandemic, but it has kept its numbers, the number of confirmed cases, below 500, and this is because the president, that is Tsai Ing-wen, introduced a travel ban from visitors from China as soon as they heard about the first few cases of coronavirus in China and Hong Kong and Macau as well. And in anticipation of this virus, anticipation of this virus and of course the demand for personal protective gears, they actually created 60 new mask production lines, and consequently they were able to produce, they got to a place where they're producing 1.8 million to 8 million masks daily, all in anticipation of what could be from this virus. So those are just some of the countries that have been highlighted here that have women leaders at the top and how they are handling their business.
Now, talking about women and how they're, leading the countries during this time. Now, on the front page of the Star, we have a very, encouraging story, if I might say so myself. And it's not about leaders per se. Is that 7 Kenyans join a race to find COVID-19 vaccine. Yes, Kenya has reported 15 new coronavirus cases, bringing the total number to 296. Now, 7 Kenyans, following that, have decided that they're not going to be left behind in seeking a cure. Remember, we do not have a cure for this pandemic. Now, Kenya has joined the race to find a vaccine for COVID-19, with a prototype expected within 6 months. 7 scientists at the Kenya Medical Research Institute on Tuesday said they were developing several vaccine candidates that will narrow down the most promising. 115 projects are currently in the race for a vaccine against the COVID-19 disease. The 5 of them have now entered the clinical phase, but how long before the first vaccine becomes available to the public remains unclear. Now, the scientists said that the process of the vaccine development, after they appeared at the Senate Ad Hoc Committee on COVID-19 situation in the country, they said is that the process of the vaccine development is expensive and will require partnering with other interested organizations or persons, to lower the cost of that, the process. They further say that it is important for Africa to join the genome sequencing in the vaccine race to avoid the rotavirus vaccine problem. This refers to the variations in the efficacy of vaccines in different regions. For instance, the rotavirus vaccine to prevent severe diarrhea in young children were effective in Europe and North America, but less effective in Africa because they were mainly based on rotavirus strains predominantly found in Europe and North America. So these 7 brave Kenyans scientists say that they need the support from interested organizations and persons to see that through. Further on matters business, if you had imported your car in the recent months, well, you might be wondering why there's a delay to get that particular number plate. Now, it seems that the importers and buyers, you've been forced to park, and this is because there's a slowdown in registration of motor vehicles following the scaling down of operations at the National Transport and Safety Authority, that is NTSA, in the wake of COVID-19. Now, NTSA has further on suspended collection of number plates, books, PSV badges, and a smart driver license and driver's testing, and as well as a motor vehicle inspection. So if you're in that business, or if you have a car that is stalling, you can find details of that particular article therein. Now, crossing over to matters, Karissa is that 31 persons have been seized from a Nairobi bus. And those 31 people had tried to enter Karissa town from Nairobi and have been quarantined for 14 days. Security officers acting on a tip-off arrested 4 of them in a car as they tried to enter the town on midnight at midnight on Sunday. Now, this calls to say that the government, both national and county, have said that if you know someone who knows someone, or you know that person directly who is in contravention of the laid down precautionary measures by the government to stem the spread of coronavirus, well, report them, and the authorities are going to take charge of that situation, because it's about surviving. We have to survive. That's about what we have on the Star this morning. You can get a copy and just read through what is happening across the world, regionally and also inter-counties.
Now, did you know that there is a call line, a hotline where you can make calls in regards to the COVID-19? Well, this line, 719 hotline, was set up by the Ministry of Health for coronavirus information. But according to the numbers in terms of the people who call this line, comparing men and women, who do you think call the most? Well, according to the numbers, statistically, it is the men. On the Standard, men jump pandemic hotline with calls. Coronavirus toll-free figures revealed this, and we have more men than women who are calling the 719 hotline that was set up by the Ministry of Health. And according to this call center data, 3/4 of the callers have been men, most of them from the Rift Valley and the Western region. But funny as it may, some calls are actually pranks, even though we have so many calls that are coming in regards to the pandemic, some needing the assurance on what the government is doing in regards to combating the coronavirus. But some are prank calls. Some are saying that they have the cure of the coronavirus, so they're calling to tell them that, hey, we have found the cure. Well, this is on the Standard. Men jump pandemic hotline with calls. Well, in regards to the COVID-19, yet on another story, if at all you are home, excuse me for that, if at all you are home and you are trying to find out what to eat during this COVID-19 pandemic, we have the do's and don'ts of nutrition to help the body. Excuse me, Jen, continue.
Apologies for that.
Coronavirus.
No, you can have some water
to make kata.
Yeah.
As we excuse Aguko, let's move on to the counties before we get to bring this segment to a close. And let us go to the western side, and this is around the Nyanza and western and Rift regions, where revelers turn to illicit brews after shutdown of bars and nightclubs. So administrators swear to crack down on the trend, saying disobeying rules will likely endanger more lives. But getting to read these stories, it is said that, there has been an increase in demand for traditional brews in Nyanza, Western and South Rift regions, with revelers thronging drinking dens, which are selling traditional brews for merrymaking in defiance of the rules that have been put in place that involve social distancing just to curb the spread of the disease. And from dawn to dusk, thirsty drinkers sneak into bushes or using also along the riverbanks and in tea and maize plantations, with police officers in these areas being accused of turning a blind eye to the illegal trade in exchange for protection fees. Now, this has been noted also in Kakamega, where the county ward representatives say, you know, they are now mobilizing local youths, and they have so far arrested 2 police officers who have been found collecting bribes in exchange for quote-unquote protection fees. And this new vice of collecting fees is said to now also be on the growth, where police go around, you know, and villages and collecting protection fees from illicit brewers that they know, because they are said to be going downright to their houses, and they do so when they're wearing their civilian clothes, and they are spotted moving from house to house. And one was actually arrested with 3,000 bob on them. This was earlier on in the week. And also the same case has been reported in Kisii County, where the assistant county commissioner did say that, you know, they are now going to start destroying some of these chang'aa dens that have been put up in the area, just to try and see if this will help in curbing this new vice that people are trying to employ. And we have also had cases of other revelers, you know, being locked in nightclubs, or even now they've turned to day clubs just to go ahead and party and continue with merrymaking, in as much as we are being told to observe social distancing and put on masks. Some have decided that they're not going to adhere to some of these rules, as basic as they are.
Now, just keeping tabs on this issue in regard to the domino effect of COVID-19, the president is live on all our KBC radio stations across the country: Mwato, Iftin, Minto, English Service, Western Service, and the rest, Nosima. There's so many, Shore FM included. And just to take some tidbits, or rather some excerpts from the president's speech as it started some few minutes ago, is that in as far as the questions that Kenyans were asking, and some of the questions is around what government is doing to ensure that, you know, issues of rent have come up. In response to that is that someone, quote unquote, says that we cannot force them. This is in regard to the landlords and landladies, is that we cannot force them. It's their property. That is something that maybe the president was actually responding to that question about, you know, just where the government is in as far as ensuring that Kenyans are not, you know, kept, or rather taken off their houses because of unpaid rent. As we see over the last few weeks, we've had cases here and there. Now, one of the pullouts is that the president has assured KCP and KCSE candidates that the national examinations will be held this year. He says that the Education Ministry is monitoring the situation. That's another issue, thorny issue, that Kenyans have been really wanting the government to speak up and, you know, just give direction. There's a lot of uncertainty with some learners accessing learning material online, while others are missing out, especially those who are considered off-grid or marginalized. Yet some entities like Kenya Broadcasting Corporation is in partnership with the Kenya Institute of Curriculum Development to just continue offering these services, both for primary and secondary school students. These lessons are ever being broadcast on TV and radio. Continue sending in your SMSs and tweets. Our hashtag is at KBC. It's a commercial corona, and hashtag Uhuru Speaks. That is what is currently trending on Twitter, if you haven't gotten there. And Kenyans are already asking a lot of questions, and these are being asked by different various media houses there. Remember, this is a live broadcast from State House, Kenya, that is broadcast through KBC and all its radio stations, and it's also available on Signet on the free-to-air set-top boxes. So get online, get on radio, get to see what Kenyans want addressed, and also have an opportunity to air your views there. And I'm sure the president, as well as the journalists on ground, are going to, you know, relay that particular information. Kenyans are also wondering is that Martha Boneri says, question is, those who escaped quarantine, will they be tracked and put back on quarantine? Maybe that's another question Kenyans are asking. We are already talking about prison break, and that particular prison break story has made it to the covers of the dailies this morning, and we have tackled them in the headlines segment. So keep your feedback coming on Twitter, on SMS, that is 2151. Remember, even this show, Good Morning Kenya, is live on social media platforms, that is Facebook and YouTube, so you can get on board. Let us know what you need, and we shall provide it. We are providing essential services so that you can stay home and still be entertained and informed.
Interview with our very own president. So far, the president has urged Kenyans to follow the guidelines provided by the Ministry of Health. And he says that those who escaped, the escapees, will be taken back into the facility to finish their days. That is what the president said. So, I'm in Bali. All right. Well, still on that, Kenya has ruled out the mass testing for COVID-19. The president has said that the government will target high-risk population for testing starting this weekend. So time will tell. Remember, that interview is live on all our radio stations, so you can be able to get them even as you continue with this morning conversation. Now, moving on to the Standard newspaper on what is currently going on in most parts of the country. Remember, it's raining. But now on the Standard, we have 4 children killed as heavy rainfall leaves trail of misery. Residents, we have images there of residents who are fleeing their homes near Ahero town to several grounds after River Nyando burst its banks yesterday. Towards the right, you have a bed in Peter Mutai's house. That is one person who has been affected by the rain. His 6-year-old daughter, Miriam, was killed after a mudslide hit their home in Kipkelion West. And we have floods, businesses, premises at Dunga Beach in Kisumu. Businesses have been have closed and have been affected by the rains. From Elgeyo Marakwet to Kericho, Naivasha to Homa Bay, destruction is sweeping through villages in the wake of the torrential downpour. What do you think about this rainfall? 4 children killed as heavy rainfall leaves trail of misery. Very sad turn of events. Even as talk about rains being a blessing, are they? Well, we shall find out if these things will be sorted out even as we continue. Remember, April is the season, is a rainy season. Moving on, we have a school beats closure with e-lessons. This is matters education. In schools where model has excelled, teachers interact with learners on a screen that conduct lessons while at the same time taking questions from them. Schools beat closure with e-lessons. We have an image there of a child who is a pupil of Children in Freedom School during an online lesson yesterday, pictured in on that story. With the effects of the coronavirus affecting every sector, life for learners has changed from physical to virtual classes. How impressive is this? Remember, KBC has also partnered with the KICD, that is the Kenya Institute of Curriculum Development, to give our children, our students, our people's education from home. And back to the story that I was telling you in regards to your health, we have the do's and don'ts of nutrition to help the body fight off corona. Are you keeping healthy? Are you staying healthy? Are you eating healthy? Well, patients with sore throat should have enough sleep, reduce stress, exercise, avoid intake of alcohol and tobacco products. Consumption of fruits and vegetables helps to improve antioxidant levels in the body, while warm fluids help clear sputum. Do's and the don'ts of nutrition to help the body fight off corona. We have images of a road. One road leads to fruits, veggies, and we have another road leading to junk food. We have burgers, we have chips, fries. What are you eating? What are you ordering from home during this time of COVID-19? I was going through my social media handles and I was seeing memes of images where we have people saying how the coronavirus will affect their bodies. One lady was posted there, wakasema before coronavirus and after coronavirus, how she looked. Well, it is a very interesting thing to stare. But now in the world of business, where we have the hustle pullout in the Standard newspaper, there is an interesting story about the things that normally people are told when they want to start a business or in the process of starting a business. It can be before or after. But here in the hustle pullout of the Standard, lies I was told about growing wealth. Why you should keep your bank closed, also in the pullout. Special forces training inspired by hustle. We have lies I was told about growing wealth in this hustle pullout. Stories by different individuals doing different kinds of businesses. These are entrepreneurs. The lies people are normally told when it comes to growing a business. And some of these lies include that business will break even in the first year. One more thing that people are normally told, that you need to take a loan to set up a business. Is this true? That you do not need high returns and high savings to grow money. Is this true? That a great business idea is all you need. Lies I was told about growing wealth. This is in the hustle pullout of the Standard newspaper. Get to read about that, the do's and the don'ts of business and entrepreneurship inside the hustle pullout.
All right, as we bring this segment to a close, let's have a quick look at what is happening globally in terms of world news. And we have a quick look at here on the Daily Nation and just look at three particular interesting stories. We start with Malawi, where, they are said to have refused the lockdown by going to court, saying that we could die in our homes. Malawians resist lockdown. Now, this Malawians have backed the trend after the court blocked attempts to restrict the population movement, which came as a relief to so many of the residents. And some were even quoted saying, had the lockdown been implemented, we would certainly have died of hunger and not coronavirus. Now, this lockdown came as a directive from the president, that is Peter Muthariki, pictured therein. And he warned that without this lockdown, that the country could actually spiral to 50,000 cases. But most Malawians, given the fact that most Malawians live under $1 a day, scrapping together wages through informal trades or low-earning odd jobs. And of course, he did say they understand the situation, but a lockdown was necessary to try and contain the situation. But a group of human rights defenders, a coalition, went to court and secured a 7-day order stopping the lockdown in Malawi, saying it was accusing the government of being haphazard and not really considering a better approach. Now, let's move on to Madagascar, where it is said that the pandemic has triggered a rush for herbal formulas, including lemon and ginger. And there we have the caption that reads, Madagascar unveils herbal cure. Pictured therein is the president of Madagascar when he was actually taking a sample of this new herbal drink that is called COVID Organics. So it was launched, and the president launches this drink, even though it is unproven medicine for COVID-19, and and it's said to be giving results in 7 days. But the Madagascar president did say that, this claimed that this drink is going to prevent and cure the novel virus. It has been tested, and so far 2 people have been cured by this treatment. It is said to work within 7 days, and it gives results. Of course, it gives results in 7 days. I will be the first one to drink this drink today in front of you to show you that this product cures and does not kill. Those were the words of the president right there. It is said to have been derived from a plant called Artemisia, which has proven efficacy in the treatment of malaria. However, experts do say that, it is a safety risk when it comes to its effectiveness, because it has not been assessed internationally, or any data from trials being published in peer reviews have not been seen also in regards to that. But the president did brush off this reservations that scientists and experts had about it, saying that they're going to offer this drink to school children, as it is his duty to protect the Madagascar Malagasy people during this time. So more of that has been highlighted there. And as we bring the segment to a close, yesterday we were having a discussion in regards to how the secondary effects of COVID-19 are going to be affecting children post this COVID-19 pandemic. And actually, the situation has already started to snowball. And this is what is happening in Harare in Zimbabwe, where at least 152 people have died and more than 170,000 people have been infected with malaria in Zimbabwe this year alone. In these 4 months that we have been into 2020, over 170,000 people have been affected, with 152 dying as a result due to the fact that health efforts are now being redirected to deal with COVID-19, which has constituted to one of the biggest reasons as to why there has been a spike in the increase of cases revolving around malaria in Zimbabwe. So you can get to read more of that to understand the different situations that different countries are in during this pandemic that we are in, as we try to come together as a people to handle this situation. Now that brings us to a close of In the Headlines. Thank you so much for being with us. We do hope you are now better positioned to know, or rather decide, which daily resonates best with you as you go about picking your copy. The hashtag is still Good Morning Kenya. But before we take a break, any more updates in regards to what is happening in State House?
Oh, just some take home of what is happening in State House. Remember, we are live from all our KBC radio stations: Ingo, Shoro, Mwago, Mweto, Iftun, Kitwek, Mayenga, Minto, Nosim, Eastern, Western, and Ambu services. And remember, all this available on Signet 2 on the set-top box, free-to-air set-top box. Now, just a take-home is that exam calendar is still on. The president says that the exam calendar is still on for KCSE and KCPE as far as the government is concerned, and that the Education Ministry is monitoring what is happening around the country, and is that Kenya has ruled out mass testing for COVID-19. President says that the government is to target high-risk population starting this weekend. So what we had earlier gotten from the Ministry of Health as well as the CS of Health, they're saying that the country is going to be conducting mass testing. Apparently, this isn't so, courtesy of President Uhuru Kenyatta's speech that is live on State House, and we are broadcasting on all our radio stations. It says that the government has ruled out mass testing, and instead, beginning this weekend, is going to begin that particular testing in high-risk areas. That's just a take-home. Remember, this live broadcasting, as far as the president's speech is concerned, is ongoing. So tune in to your respective radio frequencies across the country. We have so many radio frequencies: Ingo, Shoro, Mwato, Iftina, Nosim, Kitwek, Eastern, Western Service, Ambu Service, all that ready and broadcasting that particular interview for me that is live from State House. So do keep it right here as we keep you informed. So stay safe. Remember, this virus doesn't transport itself. It is transported by you and I. So if you have no business being out of your house, stay home, stay safe. I'm Regina Wanyara-Gitao. Now I leave you in the able hands of my colleague, that is Jane Wamboy, to continue with this particular broadcast.
What has been your greatest challenge as a parent during the ongoing COVID-19 pandemic situation? As we wait for the pandemic to be over at home, COVID-19 has given us an opportunity to reconnect with our children. Join Nakada during Good Morning Kenya Breakfast Show as we discuss positive parenting. Remember, parenting is all about you. Nakada, for a nation free from alcohol and drug abuse.
Tonight on KBC Channel 1.
What exactly was she doing there? I understand.
Elena! 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 Elena!
Remember, ukitaka kustay safe from coronavirus, lazima ufuate hizi steps. 1. Osha mikono kila time for 20 seconds. Hata unaweza imba happy birthday mara 2. 2. Usishike uso, macho na mapua yako especially kama hujaosha mikono. 3. Ukitaka kucough, utumie tissue alafu utupe kwa dustbin ama ucough kwa elbow. 4. Avoid kuenda mahali kuna watu wengi ama kusalimia mtu na kuhug mtu. In case usikie uko mgonjwa, please ambia parents wako ama guardians wako. Let's all stay safe.
Welcome back. Thank you for keeping it. Good morning, Kenya. If you are just joining us, you are right in time for the first discussion. And this is all about some of the ripple effects that are coming as a result of this pandemic that we are in here in Kenya, in Africa, and the world over. And this is a conversation that we did start earlier on in the week, but we want to pick it up and go to understand the situation further and see what more we can do as a people to try and contain this situation. And this is all about gender-based violence, which has been noted and has actually been proven to have increased in the month of March since February. In February alone here in Kenya, there were 85 cases that were reported, but in the month of March, there were 115 cases that were reported, an increase that is said to have been 33%. And this came when the CJ was giving the status update address in regards when it comes to matters to do with the judiciary. And there has been a steady increase in the number of sexual offenses cases that have been reported in Kenya, in Africa, and of course other parts of the world. But why is this a situation, and what more can we do as a people to best, bring these cases down, and especially cases that involve our children? That is a conversation that we want to have right now, and we welcome you to be part of this discussion. Remember, we are live on YouTube and Facebook. KBC Channel 1 is those are our handles on Facebook, and of course our YouTube channel. You can also always share with us your thoughts using the hashtag Good Morning Kenya on Twitter. My handle is JaneWamboy, and our SMS number is 20154. Do remember to leave a name and location. Miss D will be joining us in not too long to sample some of your views and questions that you may be having in regards to this discussion. But to help us with this discussion, we are joined by Alberta Wambua, who is the Executive Director of the Violence Recovery Center, that is GVRC. Karibu sana.
Asante sana.
Thank you for making time to be with us this morning.
Thank you for having me.
Now, let's just start. I just want to get your reaction. Earlier on in April, there was a story of a 16-year-old girl who was kidnapped and held captive for about 4 days by a sexual offender. And, when asked why he did this, he said that he needed female company during this lockdown. The fact that offenders are taking advantage of these measures that are being put in place to protect us, how does that resonate with you?
It's sad because then violence is violence.
Yeah.
And it's actually worse because that's violence that has been happening. We've been taking even the young girls, as you see. And key to note is even if that girl consented, she's below 18.
Yeah.
And there's also some times where we have women and girls consenting, but they're under duress. So what is different this time is that we have increase in the cases of gender-based violence. Just at the center, that's where I work, in the 9 centers, we've had an increase of about 45% of gender-based violence cases. So when you're talking about the judicial statistics that you got, for example, we'd have more clients coming in for medical treatment and fewer, only about 10 to 15% from ourselves going through to the judicial system.
Yeah.
So in March, for example, we had 363 cases of gender-based violence, just as GVC alone. And in February, we had about 280 cases of gender-based violence.
So this, when you talk about an increase, is definitely happening even from your end, from what you have witnessed.
Exactly, and there are many more, because then there are many other unreported cases.
That go unreported.
Yeah, because then of this crisis, you have less people coming in to report. Then because we have the curfews, we have the county lockdown, so even the accessibility to the services is also a problem. Then again, there are other many issues to play, because then now children are home, maybe the helps we have for children are not there, so you calculate, do I leave my child home, do I go for medical treatment? The alleged perpetrators, the number of times, about 90% of the cases now, are perpetrators, alleged perpetrators, not to the survivors. So this is someone you're with in the house. So at what point you get the space to even go and report? So there are many more clients, so to say, that have been violated. Then again, our culture, we would not report cases when it's psychological abuse. As Kenyans, and our culture will only report when it's physical. And really severe. So those are just some of the cases. There are many more cases, and we need to think about how then do we prevent gender-based violence. Higher of them is intimate partner violence, and how then do we also be able to provide the services and make them accessible.
All right, and actually we'll be getting deeper into that to just try and understand, the fact that you've mentioned, we only tend to report physical violence that has occurred when it comes to gender-based or sexual-based, but we never really understand the different forms of, gender-based violence that do occur. But we'll be getting to that in not too long. But remember, we welcome your thoughts when it comes to this discussion. This is a problem that has been noted to have spiked up, especially during this time that this lock-in, or rather cessation of movement was imposed. And from the cases that were reported, the perpetrators are said to have either been, most of the cases, the perpetrators are said to have either been caregivers or the guardians under which these children are, and people who they trust, and they thought are there to protect them. But at the end of the day, these are the perpetrators who have mostly been reported to be, committing these heinous crimes when it comes to our children, most especially. But we will be getting to that, and of course trying to understand the different reasons as to why, some of the victims who are involved in these cases are not able to come forward and report these cases. And of course, these are problems that have been here with us from time immemorial. It's just that we haven't really addressed them. And now, given that we are in this pandemic, it is more of a knee-jerk reaction, and we're trying to grip it, but it's not working. So some of those, we'll be looking at some of those issues in not too long. But of course, getting back to our guest this morning, remember we're talking about gender-based violence, and just looking from the stats that we were actually looking at yesterday, it is said that at least a third of the global women population have experienced one form of violence or the other. Could be physical, could be sexual, any form of violence that is gender-based. We will be getting to that in a bit. But let me just come back to you, Alberta. And you had mentioned that, we mostly tend to report physical abuse, or when it comes to gender-based or sexual. But then again, when it comes to sexual offenses or gender-based violence, it takes many forms. But most of us might not really understand what forms it comes in. So maybe you could help us better understand what are these forms that these offenses present themselves as.
So we have sexual violence, and usually at the center, that's the most common. It's about 76% of the cases that we see.
76%.
Of sexual violence, of the gender-based violence cases that we see. But of course, the forms of violence would differ from area to area, or rather location to location. I'll explain that later. We also have domestic violence, so intimate partner violence. So we have domestic violence, that's violence that happens within the home setting, within family members, can be parent, child, and all that. But in that, we also have intimate partner violence, so it's between partners. We also have physical violence, so then we have the physical injuries.
All right. Actually, just hold it just there. We'll be getting to that in not too long. We seem to be having a bit of problem with your mic, but we are sorting that in a bit. But in the meantime, do talk to us. We are going to catch a very, very quick breather. We will be back in not too long. Just stay with us. And we're back like we never left. Hashtag is still Good Morning Kenya. Remember, we are talking about sexual and gender-based violence and trying to understand the situation right now. And let's just get back to where you were, talking about the different kinds of offenses and how they present themselves. Please continue.
So there are different forms of gender-based violence. The sexual violence, that's about 76% of the cases that we receive at the Gender Violence Recovery Center. We have physical violence, so the physical injuries, the slap, the kicks, we have harmful practices, harmful cultural practices. So here we have child marriages, we have forced male circumcision, like what we saw during the 2007 election violence. We have, for example, female genital mutilation and circumcision. There's domestic violence, so violence that would happen within the home setting. So, and they would also have intimate partner violence. So this is violence between partners, between spouses. And that has been an increase, for example, during the COVID-19. There's a spike in intimate partner violence. We also have economic violence, or financial violence. So it's related to economic. So, for example, you tell your spouse they're not allowed to go and earn a living, or when they earn a living, they don't have control of what they're paid, and things like that. We also have emotional and psychological abuse that we really do not take seriously. And seriously means even when we acknowledge that we're being abused, we don't even reach out for the psychological assistance. Exactly. And this is really bad. And I'd like to mention that as much as, for example, we have other forms like intimate partner violence during this situation, often at times we forget the children who undergo psychological violence because they're within that home setting and they're seeing the violence that's happening, between the parents and things like that. Earlier I'd also mentioned that the forms of violence and the prevalence of different forms of violence would be different as per setting. So, for example, in Kenya, when you look at the Kenya Demographic Health Survey, there's certain areas that would have a higher prevalence to female genital mutilation or to child abuse but a lot of times in the urban settings would have a bigger percentage of sexual violence and domestic violence. So that's usually very different as per different area, and that also then addresses the need to have interventions like primary prevention activities or awareness activities that are very customized and targeted, because then the approaches would be very different. If you go, for example, to female genital mutilation, you'd have there's custodians of culture, they're morans or they're elders. So it's not just having discussions with the women and girls, but everyone else then who calls the shots.
Now, looking at what you have been seeing at the Gender Violence Recovery Center, when it comes to gender issues, which gender is reporting more of these cases? Is it the male or the female, especially now that we are in this pandemic?
So we have more females reporting cases of gender-based violence. This is about 90% of the cases. And there are different reasons for this. So one, we have what we call the gender or the social norms. So it's the women, for example, who would have to stay home and take care of the children, their children are home, their families. Again, 70%, for example, of the healthcare workforce globally, also confirmed that with my husband today morning, are women. So you also have the stresses of them being as frontline healthcare workers, but also they need to play their roles as women. So you find it's the women who are getting most of the stresses. We also have, for example, diversion in terms of services for sexual reproductive health and also commodities related to that. The women are also not able, for example, to... for those who are in lower wage, which is mostly women and low income, things like accessing their farms, the health systems, commodities, and the flow of commodities. So women come in as, would I say, the weaker gender or the most vulnerable. So we have lots of women then who are reporting cases of gender-based violence, but men are also being abused.
They're also those that are being
and I find like most men are going through psychological violence because then it's even culturally, it's men who provide, they're the providers. It's the African culture, so this is the time where they're not able to go and seek, and provide for their families. So they're also very stressed. You talked about Twitter earlier. I saw someone who said they would see their their neighbor's husband who just goes to the car in the morning and stays till evening and then comes back home. So there's a lot of also mental health issues that we need to address with the general public.
Now, coming back to this whole pandemic that we're in and basing from what we have seen in the past, when there are any pandemics that happen, it is said that it's mostly women who tend to, experience the worst bit of it all, and especially when it comes to measures that are being put in place to sort of contain this pandemic. Bringing it home, we have the curfew that has been imposed, the dusk to dawn curfew. We have cessation of movement between counties, and especially Nairobi County, among many other measures that have been put in place. From where you sit, would you say that some of these measures actually do have consequences that are sort of inclining to the negative side when it comes to women during this time?
Yes. And a lot of times during the pandemic, that's what happens. So one, in terms of the movement, so there's much more burden to the women because of the homework. I mean, not homework like schoolwork, but the workload has been doubled. And a lot of times the women do the unpaid work, the unpaid work that's never appreciated and costed. So there's all this healthcare, there's all this home care that they have to do for their husbands and their children. But there's also now added to that the stress of this COVID-19. It is new to us. What do we do? How do we handle it? So there's all that stress burdened on it.
Okay.
And then you have to stay as a woman sober for your family members. So in terms of movement, again, a lot of women, I mentioned, they're in the lower wage, so they're the ones who, for example, would go and wash our clothes, would clean our houses. Now that has stopped. For many reasons. We now have pay cuts, so we are cutting down on our costs. We also have to limit who comes to our homes, who comes to our estates, so they're not able to come, for example, to provide that service. So they're not also able to provide for the services. So they cannot move. They cannot, for example, access their farms. They cannot do the usual work that they would do, for example, and be able to pay for the small loans, the chamas that they do that enhances the economic level. So that's also posing a challenge. Now, apart from that, health-wise, the women are not able to access, for example, safe deliveries. We've had a lot of cases, for example, recently, where women were unable to reach the health facilities to have clean and safe deliveries. Women are not able to go for antenatal care or postnatal care. That's not important. It is very important, but it's not like a priority. They're not able, for example, to get sexual reproductive health, commodities, the family planning. I saw a guideline, for example, the other day by the Ministry of Health on family planning, and it's only oral contraceptives and I think condoms that are now available. Now, that might not work for everyone else. So that's also a burden. When you talk about the response mechanism, we need also then, with a different gender, to really have a responsive mechanism, because the women, a lot of everything now, attention for the healthcare workers, the system, the commodities, has been diverted to prevention and treatment of COVID-19. So what about these other needs that the women need? For example, the dignity packs, the sanitary, that has sanitary kits and all that. That now doesn't seem to become a priority for women.
And that actually brings me to this whole aspect of, the lack of some of these basic necessities being one of the reasons that make some of these victims who are in such situations stay. Now, you find situations where maybe there are young girls who, they are in a situation that is not very ideal, but they're not able to leave or go for any alternative because there is none, because this is their sole source of some of these, let's talk about sanitary dignity. For such cases, how can we even remember them and protect them and, put measures that are long-term such that when there is another pandemic, we don't have to resort to reactive solutions that are just knee-jerk reactions?
I totally agree. And that's why then you have a very small percentage of people who would leave, for example, the abusive situation, especially now. Where would you live to? Even to get the medical treatment is a problem. How then do you reach there? The cessation you're talking about. How do you, as you said, this is your sole breadwinner. And you'll have a lot of girls, for example, having transactional sex or even getting married for convenience, so it's not the ideal marriage or the ideal partner you want, but that. So we're going back to your question of how then do we have long-term measures that it's not knee-jerk reactions, which seems to be what we keep doing, is that involving the women and girls in that decision making, so that then they're able to, you don't assume what they need, but they're able to tell you what they need. This is the time then we have, and that's already happening with the State Department of Gender Affairs and Ministry of Health, mapping out the available resources and organizations and networks that would be specific addressing women and girls' needs. So that then when you have those networks already in play, you have them as a referral mechanism. So that's responding to now, getting to know where is help, how can the women and girls reach this help, because then the approaches have to be very different in terms of accessibility, but also then engaging with them so that there's long-term planning or engagement.
Yeah.
So that's one of the things that's happening now, getting all the players on the table, getting organized, getting the coordination, and that's really reached an advanced stage. But getting also them, the women and girls, and getting their voices so that then they're able to tell you, this is what I need. Because no one is thinking about those sanitary pads.
Yeah.
No one is thinking about, because of all this, what is it called, cut in the food supply, chain and everything else. Even simple things like nutrition and having a balanced nutrition. So right now it's about reducing the amount of food we're eating at home. We're not really keen on that nutrition, or what do the children need to eat? What do we need to eat for ourselves? Exactly.
Yeah.
The exercises, for example, and just healthy living. Most of us maybe are not going for exercise, but the fact that we need to walk to work and walk back, that was already exercise in itself.
Now, still looking at this category that might be in this not so ideal situation, but they want to leave that situation. They want to leave the presence of the abuser, and they have the only solution that was there was maybe a safe house that was in the county or community referral center. But now with this cessation of movement and social distancing situation that we are in, not many safe houses are open, and if they are open, they cannot accommodate such numbers that they used to. How then do we now create those safe spaces during this time and still try and protect this category of people?
Tough question. As service providers, I keep seeing us discussing and getting stuck. I got this woman, I got this girl, I took them to the health facility, then what? So rightfully so, they are not safe spaces. They've never even been enough without this situation. Now the cases, as you rightfully say, have increased, but we don't have the safe spaces. So tough. So for example, where I work, we provide short-term shelter and to just be for about 48 hours or of course, we wouldn't take you back to an unsafe environment. But we're trying to work really hard with the State Department of Gender Affairs and figure out where can we have some temporary shelters.
Makeshift,
But we also have lots of case management and social workers. Even at the county level, we have county social workers and also CSOs or NGO social workers. And what is happening is there's also the reintegration model, where instead of taking you back to this unsafe environment, they would have social assessments and follow up and make sure that you'd go maybe to a different, your family member, but a place that you'd be safe. And they would follow up and make sure that you're safe. So their protection also measures that are in place with the police also, together with the National Police Service. But in terms of the shelter homes, I agree, that's a challenge.
And how effective have, these follow-ups in terms of, especially when it comes to working with other agencies, for example, just the police stations, when it comes to the reporting of these cases, because they might not have, the victim might not have a safe house to go to, but they are willing to go report. Now, the follow-up process, how successful have they been?
It's been good. Yeah? It's really improved. I mean, there are apps that, there are even hotlines that survivors would call and get rescued. And there'd be follow-up, for example, from the toll-free lines, from the first institution that they report. So there's been a great improvement in terms of coordination and the referral pathways to be able to follow up on the survivor. Of course, still not good enough. Things like the data management that's still being worked on, things like the chain of evidence that's still being worked on. But there's been major improvement in all the sectors. So, for example, the health sector, there is guidelines, for example, in regards to the regime or in regards to what needs to be provided, both the medical and psychosocial support that are being followed and cascaded to all county levels. And even GBV centers being opened in referral county hospitals. In Judiciary, like you mentioned, the CJ is able to tell you these are the number of cases. So we even have a department under the ODPP that provides specific prosecutors for the sexual gender-based violence cases. We have courts, for example, now that are actually dedicated children courts or dedicated to, like Iberia, I can tell you on Tuesday, we go and we provide medical testimony for all the gender-based violence cases. So there is streamlining in each of the sectors that's really working well. At the police, we have gender desks, we have police who've been sensitized. At the coordination level, we also have what we call county gender-based violence working groups, for example, that are headed by the county commissioners and the gender officers in those counties and the children officers, and it brings all the players in that county together. So then they're able to map what are the services that different institutions are bringing on board, including the CSOs, and that's not just on the response, but also the prevention bit of it. So we have really good mechanisms, and counties where these mechanisms are really working, like Makueni County, I can tell you, They even have a center. You know, they have a GBV Center. They have champions they've trained across all the wards.
Yeah.
That's just one of the examples of the counties. They're now even going ahead and trying to set up GBV centers at the sub-county levels now. You know, they have a gender policy. For the first time last year, they allocated some money specifically to gender-based violence. So it doesn't happen overnight, but there's good progress in a number of counties, so that then we don't just have, as much as we have the cessation, you don't have all the services concentrated in just the urban centers, but also across. So the coordination it's improving. It's getting there.
It's improving. And also in terms of looking at, the number of conviction, because we always hear there's always backlog.
Yes.
And as you have rightfully said,
Yes.
there's progress that has been made, but in some cases, it gets to a point, it is dropped, or there's some form of injustice that tends to happen along the way, money tends to speak. Now, when it comes to the number of convictions that we are seeing that an actual perpetrator or offender actually is reported, arrested, taken to court, and consequently imprisoned or faces one form or the other of punishment, are we seeing any improvement to that end?
I could speak from Gender Violence Recovery Center. That has really improved. I mean, for us, I think last year we had about 300 convictions, just as GVC alone. And the same different sectors have improved in terms of the police now are trained on, they actually have SOP, standard operating procedure guidelines on how then they deal with gender-based violence survivors. They're already having that in practice. When you go to the judiciary, and I'll come back to the public and also how we fail in the judicial system. When you go to the judiciary, for example, there are weeks, they call them, I can't remember what they call them, but there are weeks where they dedicate it. I know about Milimani, I know about, they've done that in Makueni a few months ago. I know a number of counties that have done that. They'll dedicate a whole week where they're dealing with all the backlog just on GBV cases. So that's happening. Okay. And there's a lot of learning. Sometimes it was also not understanding the laws, and that's when then you're talking about the injustices.
Taking advantage of the loopholes.
Exactly. So the loophole, so you're not able to, for example, give sentencing in line with the laws, but that's happening now. Now, what we do not understand as the public is that we also play a part in the access to justice system, and it needs to start with us. Okay. So one, when we are, God forbid, abused, we need to report within 72 hours. So one, report within 72 hours to get the prophylactic treatment, but also get the evidence collected. But again, a lot of us do not report. I just told you about only 10 to 15% that would go and report and follow up. So we only have very few of us then reporting. So what happens when we do not reduce the impunity, because then it's less reporting and people feel we can always get away with it. So that's the problem.
We as a people have tended to normalize it.
Exactly. So it starts with our own selves. Even, for example, our workplaces. We have policies that speak to sexual harassment, speak to anti-gender-based violence policies, for example. Do you call each other out when we misbehave? Do I see my niece or my nephew abused and I talk and forget that we need to hush it up as a family affair? So a lot of those things happen. Exactly. Or I'm being abused, but I have to condone it because, jina ya familia, and and how will I'm going to lose all this property? Because, so it's about us calling each other out. It's about us also not being bystanders.
But do you think our cultural, reservations play a role in that?
Of course they do.
This hush.
Of course it does, but it's really wrong, and the bystander attitude is what pisses me off. There's once a lady was killed in Kasarani. The neighbors heard her screaming from 2 a.m. So they said to go and check at 7:30, she was dead. But that's the norm. They usually just beat each other like that. Yeah, exactly. So that's the problem. That's the problem with. So it's not just the justice system. I think they're doing a good job. They're trying. It also starts with ourselves. We don't report. Our perceptions, our condoning of, and it's simple things. Even in campus relationships, for example. I mean, you're there and you're behaving like a wife and making excuses for them.
He was angry. He
exactly. But also, how do conversations we have with our children, so that then they're also knowing this is wrong, and we forget that when we tolerate, quote unquote, the nonsense, our children watch, and they think, so that's how women are treated. That's how you treat. That's how you treat women as a man. So they grow with it, and they tend to think that's the way to be. So that's what we need to break and have those conversations.
That actually brings me now to the awareness level. And from what age does it need to start? When do we need to start having these conversations with our children, especially given that, what they see affects them more than what you tell them. But then again, we tend to show them more than we speak to them about these things. And as you have said, they grow up seeing mom being battered here and there, dad being battered here and there, and they think, okay, even though that's how marriage is, that's how things are. Awareness levels, at what age do we need to start having these conversations with our children especially?
So it starts with the showing, because by the time they start having conversations with you, I'm assuming, and interestingly, even a few months old babies understand when you're not happy.
Yes, they do.
Yeah?
Oh, they do.
So it's not even about happiness. They can tell there's tension.
Feel,
yeah, they can feel it. So it's about the modeling bit of it. So even when they're young, that they can't talk, do we shout at each other? Do we treat each other so badly? In their presence. So it starts from there. I keep joking, but it's serious about the toys that we buy. It starts with the self-esteems and limitations we do. So buy for this boy the aeroplanes, the cars, the guns, and then you buy for the girl the cooking pot. So you're telling her she can never be this engineer, or she can never be this pilot, or
Yours
she can
is
never
to cook.
Yeah.
Yours is the mechanical bits.
So you have these two children. So even before the conversations, you have these two children, boy and girl, or boy or girl only, and it's only the girl who has to vitu kwa meza, enda washe vyombo. You have to clean up before you join your brother to play. So you're already showing them that there are limitations. Of course, we are different biologically, but they are like gender equalities that we need to, maintain and strive to be there. So it starts from that. So conversations, again, starts even when they're really small, maybe 3 years. No one should touch your swimming costume area. No one should touch you
of
like
course,
this.
It's appropriate in a way that they can understand.
Exactly. Not everyone should wash you, and also ourselves taking time to be there with our kids, at least even once in a while as we work so hard. Wash your child. So that way you're able to see these marks that are abnormal. You're able to see how does your child react. Being there, the things we call regression, so your child, for example, so just being on the lookout and having those conversations, don't get gifts from strangers. So a lot of children, for example, would undergo repeated abuse and we'd only know after, a long time, because what you said much earlier, it's not a stranger, it's people they trust, it's people they, stay around with, they believe in. So we need to have those conversations, even if so-and-so is your uncle, is your aunt, is your what, you shouldn't, they shouldn't touch your area. But it's not just about touching, it's also about the language. Yeah, so once someone really senior was telling me how their friend, the watchman used to show the child pornography, and the child started masturbating and all that. So it's about also having conversations, not just with your child, but also all the people around you. You could try your best, but it could be your help, it could be your neighbor, it could be, but again, also building the self-esteem and assertiveness in your own child and having really open conversations. Now, it's hard. But
speaking of open conversations, and this is an area that I find so many parents, shying away from when it comes to teaching our children about their body parts. We tend to give some of these private areas names that children you might think are, child-friendly, more appropriate, but in real life, somebody might take advantage of them, and they might not know that this private part is called this in real life. Do you think we need to be just talking to our children and letting them know that these are called the breast, this what body part is called, just to keep them aware and know that, this is not supposed to happen to this part of your body from a stranger or anybody who is going to violate you in any way?
I think we should.
Some of these pet names, we need to drop them?
I think we should. Yeah? I mean, it's what it is. It's hard, as I said, because then we were really raised very differently, but they are different, and we don't teach them. They learn it from the internet. They learn it from their peers. They learn it from, and using the pet names. So we should be open, of course. We should be also let them know that, for example, they can't use some of the names of the body parts just in open and just drop the name like that. But we should have really open conversations, again, age appropriate. And some of the things that has happened, for example, the Ministry of Education and Teacher Service Commission, is that they're also having clubs. They call them integrity clubs or life skill clubs. So they're having clubs where they have peer-to-peer discussions. But again, with the number of teachers and the many teachers we interact with in the awareness bit of it. They keep saying, we've left that work to the teachers. We don't have it ourselves.
Yes.
It's really hard to have those conversations. Even myself, it's really tough. But yes, we need to.
We need to, in as much as we find these other two names more age appropriate, more language friendly, the child also needs to know the actual name of that body part.
Yes, but again,
Especially
at times when the children come to our center and they're abused, and they're about 40% of the cases, they might not use the same body parts. They'll say alinekea mti, they'll use all these other names, madudu. But again, as a psychologist and the child psychologist and the magistrates, they're able to understand, or they're able to probe and even get the child, for example, through an art therapy or drawing therapy to be able to really understand, because that's also some of the areas that the alleged perpetrators would use to really brush off the case away. Yeah.
So as a parent, we understand it's not easy. There's no manual to parenting, but these things are happening. But we also need to find a way to best protect our children. Now, still speaking of children, this is still the category that faces a lot of stigmatization and discrimination when it comes to some of these cases, and still our younger boys and girls in the teen category. When it comes to dealing with stigmatization and discrimination after reporting some of these cases, because some of them might still want to go back home, but at home, the perpetrator is there. How then do we now deal with cases of stigmatization and discrimination from close family members that might say, "Mbono ulifanya hivyo," especially in cases where the name is important, the family name? Yeah,
so it starts also with the wider community, even ourselves. So we've gone to schools where you'd find the teacher, so you go, you're from GVC, we're having a conversation saying, okay, enonlete ule kijana ule alisodomaiziwa, and he's shouting outside the staff room. So it starts again with all of us, so how do you deal with that? We have family therapies. So as much as we're supporting, for us, our purpose is supporting the survivors and their families. So as much as you're supporting the survivor, we are also supporting the families so that they're able to be supportive and not, so that it's not secondary trauma again for the child. But again, it starts with the whole reporting and how we provide the service and how we maintain the referral pathway. And it needs to be done with confidentiality and uphold the dignity of the survivor. It has to be survivor-centered and really the survivor-centered principles. So simply means that if I'm reporting a case, I don't need to, if God forbid something happens at KBC, you don't need to go and say it over the tea time. Hey, by the way, this anachapangwa na bwanake and things like that. It has to be discreetly, even that reporting has to be very discreet. And even the service providers need to have it very, discreet. It's not for everyone. So that also reduces the stigma and the discrimination so that someone is able to go back to their normalcy. But again, the people who are close, as you say, they also require a lot of therapy, not just because they would be discriminative, but also they're also sometimes more stressed than the person who's affected.
All right. Now let's talk a bit about, some of the secondary, gender-sensitive responses that can be put in place, and especially now that we are in this pandemic, so many people are undergoing stress. And a classic example is from this guy who said that the lockdown made him require company, and that's why he took advantage of this young girl. When it comes to other secondary responses that can be put in place during this pandemic period to help people deal with other stresses and avoid resorting to sexual violence cases, we're hearing so many people losing their jobs, getting pay cuts, and some are consequently resorting to violating the person of the opposite gender that they are within the same space with. What are some of the other, protective systems that you would recommend be put in place that are long-term, again, for dealing with pandemics to avoid secondary effects that result from other issues and consequently boil down to gender-based violence?
So on the mental health bit, and not just for those abused, but also the public. So having avenues, it could be even just a toll-free number I can dial in and talk to someone, spaces that, and I've seen it at my workplace, it's really working with my colleagues, where we're even able just to dial in and check on each other. So it's not more about the work, but also just, you have a breather, you have someone you can share how you feel, your fears, how do you go about this is really hard for me, and things like that, just to debrief. So that's very important for the public, for the survivors, and for the frontline workers.
All right.
So having mechanisms set so that then we can, and also information sharing. A lot of times it's lack of information. There are a few weeks
That
down.
could be the problem.
Yeah, there are a few weeks back, I was really scared. I was really in panic mode. But the more you're getting information and factual information, then it becomes clearer to you. What is it that I'm able to do? What am I, to protect myself, protect my family? So what's the scare about? What happens? So sometimes the mental stresses is because of the lack of that information. So we need to have information that is packaged and, as you say, very gender responsive and very responsive to, for example, the person living in poverty might not have access to TVs, so do we use vernacular radio stations? I was happy to them when you're talking about the president being in all those radio stations. So looking at the radio stations, for example, like Pamoja, that are very specific to Kibera, so using such avenues to really, what's the conversation that we can have with people? Again, filling people with, when I say activities that we can do. So there's a lot of idle time, So is it that we could have sessions that are online exercises that are on TV or something that we can do as a family? Just being creative. Yes, it's also a responsibility as parents to get creative and get all these creative things to do, but being able just to fill in the gap. And I've seen that with a lot of stations, including yourself, like the online the TV education channels, for example. So keeping the children educated, but also we could be doing cooking skills. We could be doing, so there are many other fun things that, or educative or family bonding things that people can do. Is it prayers? And I've seen a lot of families having different ideas, so that then it reduces the mental stress, but also keeps everyone engaged. And also then availability of services. We talked earlier about sexual reproductive health services or the mental health services or the gender-based violence services, whatever services are needed. Understanding that the survivors or rather the public might not be able to come over to the health facilities. So is it remote service delivery that we can do? But again, addressing discrimination, because then there are clinics that need to run, maybe BP clinics, hypertension clinics. There could be HIV clinics, there could be diabetes clinics, all these other clinics, people with underlying medical conditions that still need to access that. So all that really stresses. Do they have, for example, the supply of those drugs? So all this can build up to the stress levels. I saw earlier when we're talking about, is there stipends that we can give, for example? Is there the relief food, something that we can give?
Those that are hard
but
hit.
Again, always doing it, maintaining the dignity and protection and keeping the public safe. There were 2 women, I think, who died in Kibera the other day. So really maintaining and seeing, then how do we balance it? Is it giving, for example, the food package, or is it giving some money stipend so that this man can feel, okay, I'm still important, I can go to the shop and I can purchase. Yes, it's help, but we're not deciding what they need, but they are the ones who know. Exactly, they're the ones who know, do they need jogo or they need ungaya wimbi, and things like that.
Again, addressing some of these secondary effects that consequently boil down to gender-based violence. You might think that they are not related, but when you look at the chain effect, the ripple effect that arises from one thing and ending up as another thing, you would be surprised by how these situations do happen. Now, let me come to the Gender Violence Recovery Center. We have been mentioning it and talking about it, but our viewers might want to know more about the Gender Recovery Center. Tell us a bit more about, the background to the formation of this recovery center.
Wow, interesting. So GBV started in 2001. It wasn't GBV, it was a private hospital, Nairobi Women's Hospital, and they thought that they would support 1 or 2 rape cases. They didn't think there would be many. But the cases kept growing. So in the first 3 or 4 years, we had about 3,000 cases, and they realized we can't keep paying for them. It's really getting expensive. So then GBV kicked off. And GBV is a charitable trust, so very separate governance, very non-for-profit. And mainly what we do is to provide medical treatment and psychosocial support to survivors of gender-based violence, irrespective of gender, irrespective of age. The youngest sexual violence survivor we've had is about 1 month old. The oldest was 105. We've had babies who've been neglected and thrown, for example, in pit latrines, and really a number in a month would have even about 10, 15. So it's all forms of gender-based violence that I talked about. We've had survivors who'd come in and they'll tell you, I was abused 10 years ago, but it's eating me up now, and I need help, and it's psychological help. I was abused 5 years ago and I'm having incontinence. I need surgery, I need this. So it provides that medical treatment. We do about 3,600 cases in a year. when there's no violence, when there's no crisis, like there's no election period, or there's no COVID.
When times are considered normal.
Normal. We do about 3,600 cases. And a case would not just come and go. And as an outpatient, to take about 6 months to take care of a patient. Inpatients, we talked about physical violence and how we wouldn't go when it's just a slap, which is still as bad. Would have clients who have their hands chopped, would have babies who've had raped till their uterus is, out. We've had, basically they're really bad. We've had men there's a quarter we had, I think, 4 men whose penises has been chopped off. I've seen a man who's brought his balls, like zikokando, So it's really, really gross. And the line has been, how gross do you go and tell the public that this is bad? And also, how then do you also maintain and not scare people off? But we need to call it out and really stop it. So that's what mainly we do. Okay. Now, the first 4 or 5 years would continue treating, but we realize, we need to go out there and talk about this. So we have what we call primary
Civic
prevention.
Exactly.
So we have school programs, right, from primary to university programs, where we'd go and have discussions, the peer-to-peer discussions, clubs, and they're really helpful. And in university, for example, not just talk about gender-based violence, we talk about all the vices, everything else, from drugs to everything else that's happening. So they're very age appropriate. In schools, we have clubs, amazing clubs across the country. The primary prevention is across the country, and we've seen schools where truancy levels dropped. We've seen schools where performance increased. We've seen schools where we'd work with teachers and they would get president, honored by the president. I mean, it's been an amazing journey, and it's usually a whole package of engaging the children, the parents, the teachers. It's really nice. We also enhance capacity of service providers. So we'd work with the National Police Service, we'd work with the Teacher Service Commission, we'd work with healthcare providers, we'd work with corporates, would work in the commodity sector, like the tea sector. So very specific targeted programs, creating awareness, developing policies, helping them have their own response mechanisms, for example, mental health awareness, cascading and having conversations, even at a corporate level, for corporates. So willing to do one for KBC when invited. So just to have conversations, because then it's interesting that we think people know about gender-based violence, but when you go to a corporate, someone would ask you, okay, so how do I protect my child? So how do I know that my child is violated?
Questions that you might just brush off.
Exactly. So those are also conversations we have. We also try and influence practices, laws and policies. So for example, the national guidelines would contribute over about 19 or so years experience. This is what we did with this, with other partners. So how can we get it at a national level so that then you're not making a difference just at an institutional level, but also a national level. So currently even replicating our model, for example, an integrated model into the county hospitals, or the county referral hospitals. So we've done that in Elda Maravin, we've done that in Makueni, we've done that in Kisii in Kenyans and Kisii level 5. We've done that in Makongeni in Homa Bay, and many other places that we continue to do that.
All right. Now, before we check in with Doreen on the other side of social media, you had mentioned that, when it comes to you as a victim who has been offended, there are steps that you need to take and only you can take. And maybe you, just for the benefit of our viewer, what are those steps that, you need to take when it comes to reporting, seeking help, all those that you need to do if you find yourself in a situation that you may have been sexually or physically violated?
Reach out. Because at that particular point, you're so confused. So one, Jen, I'm even not believing that you're my partner and you've abused me. So there's also that, shock. So you can't even reason. Maybe you have no resources with yourself to be able to go and reach out for support and all that. So if there's someone you can trust, reach out to them. Call their helplines. So there's 116 for children, there's 1195 for adults, there's Nairobi, there's Gender Violence Recovery Center. Go there. Anytime. GVS is open 24 hours. Just go there. The police stations, go to any police station. But mostly I would request that, if sometimes the survivor cannot leave that area, so just call the toll-free numbers. They'll be able to send you an ambulance or get cops to come and get you out of that situation.
Help will be sent
to you.
Okay.
So once you reach to any of these service centers. So if it's the police, they'll refer you, for example, to the hospital. If it's the hospital, they'll do a whole case management. They'll give you the treatment. They'll give you psychosocial support. Is not just the psychological, but also the social assessments. Like, what do you need? Do you need shelter? Do you need to go to a safe place? Do you need legal aid? So they're able to connect you with all support that you need. And kindly, it's not just, there's a whole cycle of violence. So it's not just the physical violence. Even when you feel that something is wrong, or something is going to get bad, or even
you don't feel safe?
You don't feel safe, kindly just reach out.
Okay.
Yeah.
And it begins by just reporting.
Yes.
Number one, you need to report.
You just report
immediately.
Because
that is one of the biggest problems that we are facing.
Exactly.
When it comes to the first stage, and that is reporting.
Exactly.
All right. So if you know someone or have been in a situation where, as Alberta has mentioned, you even feel unsafe, you fear for your life, that is not an ideal situation. That should not be the situation for anyone out there. That is a violation of your rights as enshrined in the Constitution. So number one, if you feel unsafe, if you have been physically, emotionally, psychologically, and all these different forms of offenses and how they do present themselves, if you have faced any form of this kind of a violation, please go and report. Or if you know somebody who has faced this form of violation and they are keeping quiet, why don't you be the person to encourage them to go and report? And if you can't get access to a place where you can report, there are toll-free numbers. Alberta had mentioned that for children it's 116, yes. And for adults it's 1195.
Yes.
You can be able to call these numbers and help will be sent to you. If you are in an area that you cannot access a police station or a recovery center or somewhere you can get assistance, call these numbers. They are toll-free and help will be sent to you, either cops or an ambulance or somebody who is best positioned to assist you when it comes to dealing with some of these offenses that we are trying really hard as a people to get rid of, and especially now that we are in this pandemic. And it's really sad that they have actually increased. It's really sad. Now, before we get to call this a conversation, Dee, what do you have on your side?
Right. Remember, we are live on Facebook and on YouTube. You can stream live. That means if you're going about your businesses and you cannot have an access to a TV. But also on Twitter, our social media platforms are up and running at Jane Wamboi, at Ram Aguko, at Ray Manyara, and mine at Doreen Arange, as well as at KBC Channel 1 TV. The hashtag is Good Morning Kenya. So in regards to the discussion about the sexual and gender-based violence, this is just some of the tweets that are really coming up. And people really feel like it is time we need to stand up, and this pandemic should not be an excuse. But let's look at this one. This is at Judy, who says that governments and international organizations must continue to ensure relevant information and systems are put in place to combat this gender-based violence at the forefront of this COVID-19 response. And just to put it out to our guest, Alberta, do you feel like, coming back to Kenya, do you feel like our governments have put up systems that can ensure that people can reach out, just aside from the toll-free number? And if not, which other systems can be put in place to enable people to speak out, especially when they have been affected by such kind of an issue?
So yes, the government, I know working groups that are now working under the State Department of Gender Affairs, but also the Ministry of Health. So what they've done is that we've mapped out all service providers. So you need to update the referral database, for example, when an emergency like this happens. They are setting up, all partners. Now there's coordination both at the county levels but also the national level. And there's a follow-up I think there are 2 meetings in a week just to follow up. Yes, it can get better. There is resources that have been put aside for gender-based violence, that I know. I need to follow up on then the next steps in terms of that. So yes, there are systems that are being put in place.
All right.
And help is there. And we're able to have different partners, and I know a couple of cases that have been able to be supported through these committees.
Dee?
Yeah, well, exactly. That goes to Judy as well as any other Kenyan who was wondering if there are systems set up by government to ensure that people can reach out. Well, just like Alberta has mentioned, there are systems set up, and that means you can reach out. Also, another one from Justine saying that gender-based violence is not a women's issue. It is a human rights, public health, justice, patriarchal issue. So these are your issues too. So that means that it's not just women's, but these are issues of course of different other sectors. And she continues to say that at least 4 women tragically, of course, lost their lives in what we in different parts of different parts across the globe. She just mentioned some of them, but ideally from this tweet you're picking out that it is not a women's issue. And again, just to put it to Alberta, people tend to think that gender-based violence is just a women's issue, and that the male counterpart do not suffer this kind of things, you know, for them as well. Just clarify for us, is it solely a women's issue, or the male counterparts also get to suffer from this?
The male also suffer, and it's really bad for them. And again, there's the cultural bringing that even makes it worse, in that men are exactly. So they would really, really suffer and not talk about it. That includes also seeking for help. And even when they seek for help, the ones I've seen at GVC would not even want, they want the help, but they just want the medical help. But it's very hard for them to talk about it or seek redress after that, or they can't just believe.
They don't want the psychosocial assistance?
Exactly. And sometimes when it's sexual violence, and for example, and they're not admitted, they would come for the PEP, the post-exposure prophylactic treatment, but sometimes don't even tell their partners. It's that bad. You know, that means they can even expose their partners. So it's really, for them, very confidential. So yes, men get violated. We've had about 10% of the cases, and that means 400 in 1 year, just as GVC. And it's all forms of violence.
And these that have been reported.
Those are
so
reported.
You can imagine those that
so it's right
reported.
from, I talked about the ones who got their manhood chops. I've seen serious burns, you know, I've seen psychological, I've seen gang rape for men. You know, so it's all forms of violence. Forced male circumcision. So yes, men also get abused.
It's not a women's issue.
It's not a women's issue. And then again, also in terms of prevention, it's not also a women's issue. It's both genders to come and have that discussion. Because when you want, for example, this woman to have equality, you have the men who are in control of the resources and the patriarchy that we've been brought up with. So it's not a competition. So men and women need to realize it's about equality.
Now, before we get to crossover back to Doreen, you know, speaking of that, you know, platform where men and women are put together to talk about these issues, when it comes to dealing with these issues with our children, we tend to separate them when we're having these conversations. Do you think this could also be adding to the problem, the fact that, you know, men don't really understand some of these things that they might be doing that are offensive to women, and women don't understand some of these things that they may be doing that are offensive, you know, in a sexual or gender-based level to our male counterparts? Having these conversations both separately and together, could that assist the situation?
Exactly. So you don't need to have it, you need to have both.
Yeah.
So there are conversations you have separately. Yeah, so like menstrual periods, things like that. But there are conversations that you have together. So including for adults and the male engagements that we've done and the female engagements that we've done in different parts of the country, we have them separately. But then again, there are times then that you have to bring them together because they need to air out the issues. You know, nakasirikanga unaleta. Someone joked and said in the 3 weeks that they've stayed home, they've had a summary of their 30-year marriage and all the wrong things that they did. You know, so the thing is, we were very, you know, 2017 Teresa, but Samoja ulifanya Jen. So we are wired very differently. But we also need to appreciate our needs and how we engage very differently again. So yes, you have the conversations separately and very specific conversations, but you also have conversations together. That includes also for our children.
All right. Dee, before we get to close this conversation.
Yeah, and I can tell you the feedback is really overwhelming. But due to the interest of time, let me just read one more. This is from Moses Mulia, who says that some victims don't report and choose to die honorably, probably because of culture. It is upon us to sensitize them on the procedures to take. And again, just to pose it to Alberta, what is the effect of culture in regards to reporting such cases? Because yes, someone might have offended me in whatever aspect, but because of my culture, I feel like, let me not say. What is the impact of culture in regards to how people respond to such issues?
It's really huge because sometimes we even get violated and don't realize we're being violated because it's cultural. You know, it's the culture. Nikimila. So it's really, really bad. I can give you lots of examples.
In brief, we are completely out of time.
I won't even give the example. Yeah. But again, even the perpetrators, the alleged perpetrators, sometimes do not know that they're violating you. Some years back in 2011 when I was in Turkana, there's a chief who used to beat the wife. And after we had very long conversations, like, mimi nilikuwa nafikiria ni kawaida, hata yeye anasemanga nisipomchapa simpendi, you know. So it's you know, I mean, it's both ways.
Yeah.
It's sometimes the perpetrator does not understand that they're violating you. So we need to have, again, create a lot of awareness on that. Sometimes it's the custodians of culture, you know, the gatekeepers, the wazes, who again might also be perpetrating the violence, you know, and we cannot speak up. The keeping of the name, ni bibi anaeka nyumba pamoja, and things like that. So it also has very negative implication in terms of how then do I leave my marriage, or how then do I seek help, or how do I call out someone who's abusing me.
All right, again, boiling down to this whole conversation of cultural reservations that are retrogressive. But due to the constraint of time, we are completely out of time. Thank you so much, Alberta, for joining us this morning. We have been speaking with Alberta Wambua, who is the Executive Director of the Gender Violence Recovery Center. You can reach out to her and get to know more about how you can get assistance if you know someone or, you know, are in that situation. Very quickly, social media handles?
At GVRC Kenya.
At GVRC Kenya.
Yes.
All right. So you can reach out and get the assistance that you need. Now, that is that from our end of things. Thank you so much for staying with us right here on Good Morning Kenya. And on behalf of the entire crew right here on Good Morning Kenya, we do say have a lovely day. Be sure to join us again tomorrow morning. My name is Jen Boy. Have a wonderful day. God bless.
Thank you.
Na amenigonga na nyama zenye
The Juakari operators and others, our saloonists, Mama Mboga, our barbers, our economy to a large extent depends on you. We cannot allow Kenyans to die because of non-distancing in any sector. So those of you who are carrying out the hair-cutting business, in barbershops, in saloons, I am appealing to you today. Ensure that social distancing, fumigation of your working places, masks are used at all times. Just assume that everybody is positive and now deal with that situation. Participation of our citizens in the fight against the disease would be our key success factor.
This Wednesday on KBC Channel 1.
I know you're dying to find out what's going on.
So, how did it go?
I say, wacha kuwa mstubborn, sawa? Usiwori juu yangu.
You are a terrible liar.
Okay. I did want to know if you were okay. Pamela was concerned about you.
I don't understand. Where's Elena?
I don't know. She left. Monte Cristo took her to a midwife and the baby's dead now.
Oh my God.
speaking be accorded again to the leader of the majority party and the leader of the minority party and the chairperson. From the clips that you can see, of course, the speaker is already on his way to the chamber. Remember, these broadcasts are brought to you by the Parliamentary Broadcasting Unit in conjunction with Kenya Broadcasting Corporation. And we can only wish you the best of viewing. Enjoy.
Wajumbe, tuombe. Ewe Mwenyezi Mungu, ambaye kwa hekima na wema wako umeteua nyadhifa za viongozi na mabunge kwa ustawi wa jamii na utawala wa haki wa wanadamu, twakusihi ututazame kwa neema nyingi sisi watumishi wako ambao umeridhika kutuita ili tutekeleze shughuli muhimu za jamhuri hii yetu. Twakuomba ututeremshie baraka zako sisi tuliokutanika hapa, na utujalie tuyatende na kufikiria mambo yote yatakayofikishwa mbele yetu kwa njia ya haki na uaminifu, ili utukufu na sifa zako ziendelezwe na ili kustawisha amani, ufanisi na heri ya nchi hii yetu na wale ambaye haja zao umezikabidhi mikononi mwetu. Amen. Honorable members, it's confirmed that we have the required quorum. First in a very long time, Wednesday. I mean, we've not had it in many Wednesdays before, but we are lucky to have it now. So business will begin.
Order number 1, a demonstration of oath. Order number 2, communication from the chair. Order number 3, messages.
Just a minute, honorable members. I am the message. Communication from the Honorable members, we will come back to that later. We will proceed as there will be a message later. So let us proceed to the next order.
Order number 4, petitions. Order number 5, papers.
On this particular one, we have a raft of papers. We will start with the Leader of Majority. Leader of Majority. Yes, for you to lay these papers. I think you have many.
Thank you, Clerk. Honorable Speaker, I beg to lay the following papers on the table of the House today, Wednesday, April 22nd, 2020. Number 1, legal notice number 32 of 2020, relating to the Law Society General Regulations 2020 and the memorandum that is explaining. 2, legal notice number 33 of 2020, relating to the Special Economic Zones Amendment Regulations 2020 and the explanatory memorandum. C, legal notice number 40 of 2020, relating to the capital markets, in bracket coffee exchange regulations 2020 and the explanatory memorandum. 4, legal notice number 41 of 2020, relating to the capital markets, in bracket commodity markets, regulations 2020 and the memorandum that is explaining. Number 5, legal notice number 50 of 2020, relating to the public health COVID-19 restriction of movement of persons and related measures, rules 2020 and the explanatory memorandum. Number 6, legal notice number 51 of 2020, relating to public health, COVID-19, restriction of movement of persons, and related measures, Nairobi Metropolitan Area Order 2020 and the explanatory memoranda. Number 7, legal notice number 52 of 2020, relating to public health, COVID-19, restriction of movement of persons, and related measures, Mombasa County Order 2020 and the explanatory memorandum. Number 9, legal notice number 53 of 2020, relating to the public health, COVID-19, restriction of movement of persons and related measures, in bracket Kilifi County Order 2020 and the explanatory memoranda. Number 10, legal notice number 54 of 2020, relating to public health, COVID-19, restrictions of movement of persons and related measures, Kwale County Order 2020 and the explanatory memoranda. And finally, Mr. Speaker, annual performance report for the financial year 2017-2018 from the Ministry of Public Service, Youth and Gender. 2, the report of the Mediation Committee on its consideration of the following bills on behalf of the Chairperson Mediation Committee. And these Mediation Committee reports are the County Government Amendment Bill number 2, Senate Bill number 7.
Very well. Did you do the second bit? No, you did your bit. Now let's have the Chairperson Budget and Appropriation Committee.
Honorable Speaker, I beg to lay the following paper on the table of the House today, Wednesday, April 22nd, 2020, report of the Budget and Appropriations Committee on the second supplementary estimates for the financial year 2019-2020. Thank you, Honorable Speaker.
Very well. So we go to the next order. But before we get to the next order, I will resume what I should have done on the third order. Order, members. I have a message from the Senate. What is it, Honorable Leader of Majority?
This morning you are a bit in a hurry. The Chair of Finance also had a report to table, with your permission. And I'm very sorry, I apologize. I apologize to raise a point of order when the Speaker is on his feet. But the Chair of Finance has a report to table.
Well, which one? Because I can't see it. Well,
you tell us.
But we can have it. What is it that we have?
Thank you, Honorable Speaker.
And by the way, Honorable Limo, you know you can still speak with the face mask, you know.
Honorable Speaker, I beg to lay the following paper on the table of the House today, Wednesday, April 22nd, 2020. Report of the Departmental Committee on Finance and National Planning on its consideration of the Tax Laws Amendment Bill 2020. Thank you, Mr. Speaker.
Very well. That was an extremely important one. So, honorable members, I will pass the message from the Senate. Honorable members, as you are aware, the Standing Order 41.5 of the National Assembly Standing Orders requires the Speaker to cause the transmission of any message received from the Senate at a time when the House is not in session to every member, and later report such a message to the House at its next sitting. In this regard, on April 16, 2020, I did notify you of a message from the Senate regarding the passage of the Division of Revenue Bill, National Assembly Bill number 3 of 2020. Honorable members, the message conveyed that the Senate considered and passed the said bill on 14th April 2020 with amendments to Clause 4 under the schedule, and now seeks the concurrence of the National Assembly on the said amendments in accordance with the provisions of Article 112(1)(b) of the Constitution. Honorable members, upon notification to all members pursuant to the provisions of Standing Order 41.5 and 6, I did refer the message to the Budget and Appropriation Committee for consideration. I'm aware that the committee is already seized of the matter and will submit its report this morning.
Article 94, 95 of the Constitution is clear that this House has a responsibility to resolve issues that are of concern to the people of Kenya. And Mr. Speaker, there are a group of Kenyans who have such a big number in the Republic of China, and even a significant number in the Republic of India. But, Mr. Speaker, I want to particularly focus on those Kenyans who are suffering in the Republic of China. That I am aware, Mr. Speaker, that a committee of this House, the Committee on Defense and Foreign Relations, has been seized of this matter. But I thought, Mr. Speaker, that this morning, this committee would table a report to the House, because this matter is urgent and needs to be disposed of urgently. But, Mr. Speaker, during the tabling of the reports, I didn't hear anything from this committee. Could the chair order that this report be tabled to this House urgently so that we can have opportunity to address this matter, Mr. Speaker? We cannot keep quiet when a group of Kenyans, for whatever reason they went to China, are suffering in the Republic of China. Mr. Speaker, I want to seek for your indulgence to ask the chair of this committee, Honorable Metito, to table this report as soon as this afternoon, Mr. Speaker, so that it can be dealt with. Thank you, Mr. Speaker.
Well, I would want to know, the difficulty now is that the members don't sit in their ordinary places. Do we have the leader, the chairperson, Defense and Foreign Relations Committee in the House? In absence, and I think rightfully, the leader of majority should be able to say something to it. The leader of majority.
Mr. Speaker, this is a very, very serious matter, and I want the government to hear me. And I think we made a mistake first of approving the ambassador to China. We know her history. Mr. Speaker. Those Kenyans in China, they are being mistreated by the Chinese government and the people. Let us not hide. Let's not hide. We talk to them. We are talking to students. They are locked in rooms. They are beaten in the streets. And we cannot compromise the lives of our people just because China gave us some loans. Mr. Speaker, what is wrong? I remember during the Kibaki's time, presidency, I was in this house. Many Kenyans were evacuated. I can't remember. Foreign minister was from South Africa, yes, during the xenophobic attacks. President Kibaki ordered Kenyans to be evacuated free of charge. This story of Kenyans to be evacuated from their own pockets, students, how will they pay? Speaker, I'm going to, if you allow me, after I finish the first business, I will look for Honorable Katom Olemetito, and he must bring a report this afternoon, and we must discuss it.
Yeah, I think, honorable members, actually the direction the leader of majority took would have been different, because what I would have expected is for us to get to know from the leadership whether they are ready with the report. so that if you have any contributions, you will be able to make at that particular point. Now, honorable members, it is, what we are going to do is to confirm from the leader of majority, not leader of majority, the Defense and Foreign Relations Chairman, to confirm that he can be able to table a report, and then the members will be free to discuss. Now, I see there are many members who are interested in talking to it, but I do not think I will allow it for now, because I think we will be jumping the gun. In the afternoon, we probably will be having that report table, and therefore you'll have an opportunity to, canvass your positions. So let's go to the next order, honorable members.
Order number 6, notices of motion.
Under this particular order, we have the leader of majority party. Are you ready, honorable leader?
Which notice?
We expect you to give a notice on the mediated version of the County Government's Amendment Bill and the mediated version of the County Government Amendment Bill number 2. There is Senate Bill number 7 and Senate Bill.
You know, Mr. Speaker, I am just a messenger, and I have not been given the notice. So I'll give the notice in the afternoon.
Okay, that is fine. That is fine. But honorable leader, should you be ready before we go to order number 8? We could still give you an opportunity if you will be ready. So let's have the chairperson, Budget and Appropriation Committee. Are you ready? What is your point of order? Now, and by the way, it becomes very difficult, but from the forehead, it looks like it must be Jomo. We are using other features to identify members.
Bald head.
And the size of the chest. Now, let's see. You could still, please, wait for your microphone from there. We are discouraging members from moving, from being pastoralists at this particular,
behind you.
Era. So let's see. You could use that one.
Thank you, Mr. Speaker. My point of order is on our new mode of dressing. We have been required to wear masks. And Mr. Speaker, we are leaders in this country. And in whatever we do, those who we lead copy from what we do. Mr. Speaker, I'm seeing many members, when they stand up to talk, they draw down their mask.
Yeah.
Sometimes they pull down the mask to their nose so that their nose are exposed. What we are going to do here, Mr. Speaker, is going to escalate to the rest of the country. We must show the country the right thing to do. We must wear our masks in the right way that it's supposed to be worn, Mr. Speaker. I know people have been complaining that their breathing is very hot when it is inside the mask. Sometimes it is not very fresh. But, Mr. Speaker, let those who are not having fresh breath now get a taste of what they have been subjecting us to, so that they can also practice, good dental habit. So, Mr. Speaker, let us set example to the rest of the nation how we are supposed to be disciplined in terms of the requirements of COVID-19.
I think.
Thank you, Mr. Speaker.
Honorable Jomo, you definitely are very right. But before I even make a more substantive decision on that, let me hear the chairperson health, because this is a health matter.
Thank you, Mr. Speaker. Mr. Speaker, I just want to really agree with what Honorable Jomo has said. Mr. Speaker, we are the ones who are the leaders and people follow. Wearing and the proper wearing of mask, any person should have his mouth, his nose covered, all the way down to the chin. And Mr. Speaker, not the eyes. So from the nose. And if you pull down that mask, then you should discard it and have another one. Mr. Speaker, we are sharing microphones here. And we also, the world is watching, Kenya is watching. I've also seen even some leaders in the government, when they are addressing, they just remove their mask and speak. So, Mr. Speaker, if we are to follow the procedures and the rules of this House, I request all members, when we are here, kindly cover from your nose all the way down to your mouth, all the way to the chin. So I don't know what's...
Actually, Honorable Chair.
And there was a question, Mr. Speaker, that was asked by Honorable Kago, and I'll be reading the statement later, just on the proper use and which masks should be used where.
Correct.
Yeah.
Now, honorable members, I think what the two members have raised are legitimate concerns. You see, honorable members, what you may realize is that when you are using the mask, it's not that you are only protecting yourself. You are also protecting others. You would hear some members who would say, you know, I've been tested. You could have been tested yesterday, and you could still contract COVID an hour later. So, honorable members, there are things that we actually need to take very seriously, because it is not a matter, you know, we cannot afford to be selfish. That it is something that we must be very serious. And honorable members, you could still, other members, I am speaking. No, honorable members, I think it would be very unfortunate if leaders take some of these things, joking. I will not allow that. At least I will not allow that myself. For members who think because they tested themselves and they are free, so we cannot accept. Honorable members, that is exactly what you are going to do. I mean, we cannot afford that kind of attitude here. Honorable Cecil Mbarire, what is your point of order?
Mr. Speaker, I'm a bit worried because, you know, the leader of majority, who is my boss, seems not to follow the instructions of the Ministry of Health. He's supposed to have his mask on throughout. And I think the problem he's having a mask that I think is for industrial purposes. So if you give him a mask like this one, he will breathe better. That's why he's struggling, Mr. Speaker, and he's endangering his life and ours.
Well, Honorable Cecil Mbarire, we will allow Honorable Chair of Health Committee later, when he's doing a statement, to be able to tell us which kind of masks are recommended. No, honorable members, please, on this particular one, I will not accept. Let's hear Honorable Nyikal, who is a doctor, and I have recognized you on the basis of what I see again on top of your head.
Thank you, Mr. Speaker. Colleagues, Mr. Speaker and colleagues, this is a technical matter. This is not a matter of power. This is a matter where if there is exposure, we are actually contravening our own laws.
Correct.
Our own regulations. Mr. Speaker, we cannot actually jeopardize the health of others. What it then comes out is that if there are people who are unable to use the masks, then it's good to say that they then cannot sit in the house. Mr. Speaker, that is all there is to it, no more.
Honorable members, and I think you should listen to this one.
It is bad for the president. And Mr. Speaker, even the president can get sick. Mr. Boris Johnson ignored, and look at what happened to him.
No.
Mr. Speaker, on this one, you cannot compromise.
I am agreeing totally with Honorable Nyikal. Whether you say no or whatever, I am saying I agree totally with Honorable Nyikal. Now, there is absolutely no reason why we are going to compromise just because we want to make some people happy. Now, we will expect Honorable Chair of Health Committee to speak to it when she will be giving a statement. I'm not giving you any chance. Honorable Dr. Amalwa, this is a technical issue. By having that title doctor does not make you a physician. I have given an opportunity to Honorable Nyikal. We go to the next order. Next order. We have the Budget Committee Chair. Then we'll go to the next order. Honorable Minority Leader, I'm not going to open this. We will open it when she will be giving a statement. No, I'm not going to. Let us have a Honorable Chair Budget. You know, sometimes we must be serious, honorable members. Yeah, let's proceed. Let us proceed, honorable chairperson, budget. Proceed. Allow us to give opportunity to the chair budget. I think, yeah, you have the microphone now.
Thank you, Honorable Speaker. And as much as you've closed that debate, Honorable Speaker, I think if the leader of majority removes his mask, and I'm still wearing mine,